Didn't know if you guys were here or not.
Oh, we're here.
You're here.
Oh. Hey, guys.
We are live, so
Okay.
we're gonna reopen.
So we're gonna reopen the meeting from yesterday. This is part 2 of the budget workshop. And this is the second day of the budget workshops. We will, Lord willing, finish up today. And we're gonna start with Josh Webb and the coroner's office.
Good morning, everyone. We have submitted a budget. It's, there were some changes, with salary, and asking for an additional deputy. To the 3 we already have, that's in 31st. Some justifications for that, and as well as some updates, if I may go ahead. I promised you guys last August that I would give you a more comprehensive update. I was only in office for, I think, 8 months, and we made a couple of good jokes about the previous administration because he was sitting right behind me. He has to do a funeral this morning, so we're not able to have him as a prop this morning. So some updates. We have transitioned to a reporting system furnished by the state of Indiana called CoHero. And I will supply all of this to you, is that correct? To disseminate to the rest of the council, all of that individually. So the Indiana Department of Health has transitioned local offices to CoHero, tracking of all violent and unexplained deaths. Although we do report all of our calls to this case management system, just for purposes of year-end reviews and so forth and so on. Okay, overdose, suicides, accidental deaths, industrial deaths, those kinds of things. Streamlining data for grant funding is a reason why that they're going towards this system. The system requires pretty intensive case level data entry. We have to upload documents. We have to draft narratives, and our due diligence in our office for compliance, we try to be as exhaustive as we can, because it doesn't matter until it really does. Until you're subpoenaed by a prosecutor or a defense attorney or a plaintiff's attorney or something like that years down the road. So we're trying to up our game, if you will, in terms of recording almost every detail of a call. So we are handling nowadays some fairly complex freedom of information requests. We are limited by statute in what we can disclose or what we're able to disclose, thankfully, because we do share information with other agencies. Sheriff's Office, Indiana State Police, Department of Child Services, etc. But some of our standards and practices and means and methods would probably be exposed if we had to give our entire reports. So we need, whenever we have one of these requests that come in, we don't have an attorney on staff. And I know we have resources for that, but instead of bothering them, we try to analyze these the best that we can and divulge only what we're required to divulge. So that's been taking up quite a bit of time in the last 6 months anyway. We have another development, we have, there's been a board that has been stood up to replace a minor fatality review, commission. That was a regional, operation, until last year. And a county-specific, committee is being stood up with our first official review meeting being later this month. I believe it's the 24th. Other members include, I think, law enforcement, the school system, prosecuting attorney, myself, and others to review the deaths of minor children within Jefferson County. So that is an additional responsibility that we obviously, it would be silly for us not to participate in that. And it's implied that we must participate in it, but I feel that this additional responsibility, we have to embrace it and take it on. So there are some additional hours that are involved in accumulating the appropriate documentation and consultations that are required for these kinds of reviews. So again, some justification for an increase in salary and an additional deputy. I'm kind of happy, I am happy to say, very happy to say that under my administration, deaths are down. In 2025, pardon me. So organized, I let that it was stay on my desk. In 2025, we had 111 deaths. Compared to 2024, we had 177, I believe.
That's just the person in charge.
Yeah, people are just afraid to die whenever I'm in charge, so that's good. We like it that way. New sheriff in town, right?
That's right.
No, obviously, we make light of this, but I do believe of our numbers, and I'm going to get into the numbers since last August when I was before you. I think that would be an easier way to explain this. Obviously, you can only try to raise awareness of certain issues. You're not going to be able to prevent accidents, natural deaths, things like that, but behavior-related fatalities, those can be influenced one way or the other through raising awareness. And I believe we touched on that last year, our involvement with suicide prevention outreaches with Norton King's Daughters and other agencies, groups, and organizations, law enforcement. I will read those over now. From August to August, August 1st to July 31st, 25 to 26, 0 homicides, 8 suicides, 1 motor vehicle accident, 4 accidental overdoses, other accidents, which are anywhere from residential, private to industrial accidents. There have been 8 of those, and natural deaths have been 91. So our total, I said 111, it's 112 deaths from August to August. I'll get you the 25 cumulative total, and obviously we'll go from there, but for purposes of discussion today. So that's basically our summary. We transition to CoHero, the full adoption of the Indiana Department of Health's digital reporting system for violent death surveillance. We've been securing compliance and state grant eligibility whenever we're using that. So the Jefferson County Fatality Review Board participation, enhanced public record compliance, and expanded responsibility in terms of critical review of our reports that we release due to freedom of information requests.
I have a question.
Yes.
So this was something that was hit on at the auditors conference, that the public records requests are going crazy and
Yes.
like all across the state. And they were encouraging everyone to get a portal so that it's tracked
Mhm.
as it was received in, and then have a policy to charge up to $25 an hour to
Okay.
retrieve those records.
Okay.
Would that be something that would be beneficial to you guys?
That would be, that would offset, some costs definitely. and
Because
some
it's
time and
also a way
frustration.
that we could
Mhm.
have, all those requests logged as to when they were actually received. And then Pat would have easier review of them if it's too broad for
Mhm.
us to respond.
Right, yeah,
Cause like I have one right now that's very, very broad. I don't know
complicated,
how.
yeah, very complicated. Yeah, that would, we were not aware of that kind of a resource, or, that, potentiality, if you will.
Right,
So I,
so it's something that
at the
I,
Corners Association, we're basically only told like, well, your council or your commissioners can only basically raise a death certificate, fee, and I don't think death certificates should probably cost $300 a copy, but, that's probably that kind of an increase that you would have to ask for, you
Right.
know? So yeah,
that would be beneficial for you guys too. Okay, just making sure.
yes, it would be.
I think that's a wise idea to charge a fee for those,
Hmm.
because we're charging fees for death certificates.
Yeah, I'm not, again, as a head of a department, I'm not aware of, I'm not sure what we're able to charge, what our purview would be if we're able to institute a fee unilaterally, without, some sort of action or sanction from a larger governing body, if you will, fiduciary body.
It should be countywide.
Yeah, it would be countywide if we ended up doing a policy of that.
Okay, all right.
I
For
know
like
I've
all
been-
FOIA, sorry, Heather, but like for all FOIA or requests, okay, that would be, yeah.
I know I had been in some conversations early on just to help connect the right people, to make sure that we were trying to improve communication and process to, we had, I think, some positions that weren't, we had some dated emails, they weren't getting some email notification that they needed to log on to sign death certificates.
Drive system.
Yeah, and that I think improved,
It did.
but there were still just, I think, some upset folks that were trying to settle up with, all things death related and, insurance policies with family members, and they were waiting weeks and weeks after to still
Yeah.
get their hands on a death certificate, and it wasn't necessarily a fault of just a doctor or just the health department, but I know there were some frustrations with the health department and obviously coroner's office.
Sure.
Do you feel like that process has improved?
I think the drive system, has, everybody's gotten used to it now, finally. That was a nightmare. It was the original system, I think, was instituted during.
It's not difficult.
In the middle of COVID. That system was scrapped mid-COVID, not a good time. And the funeral directors and coroners and doctors did the very best, along with some tech people, to try to make it work. I think everything is running smoothly now. In regards to that, it did take about 2 years to shake some of the bugs out of the system. Any delays though, and this is nationwide, global, tox takes time, toxicology results. It used to be 20 days. I now tell people expect 40. It's just easier to expect 40. If it's early, I'd like to over deliver and under promise on that. Because we are using NMS, which is for our purposes, a state-of-the-art resource to process toxicology. The Indiana Crime Lab does have a system and there have been funding improvements to that system. But there has been some informal discussion that it's still not where it needs to be. So I think the system that we're using now is still the best that we have. It's just that the demand has just gotten so much higher to process these things.
I had a couple more questions,
Okay.
if that's okay.
Yeah,
One,
absolutely.
in last year, we did, see an increase in, improved increase in forensic. The year before, a couple of years in a row, significant increase in autopsy.
Right.
Budget line item because it was necessary.
Right.
I think we even had a couple years, we had to do a
we
reappropriation
did.
just to
Yes.
make it through. But last year, forensic supplies, fuel, and toxicology all had an increase. At mid-year this year, there was minimal to no expenses there. I guess for one, if you're requesting salary increase and potentially even one additional second deputy, if that's something we can discuss and potentially make happen, are we, is there leadway in those? Do you feel like we'll spend 100% of what's allocated? Well, we could potentially.
Well,
decrease
again,
there.
that's the only thing I can't, that's where I say I can't really project because I don't know about an autopsy bill, you know, I know we have used funding, we're talking about the reallocation, we were just talking about that, out in the hall.
We haven't had to do that last.
We haven't had to do that in the last two years, but our numbers are down. Our numbers are down, thankfully.
So I don't know
And
what
that,
that'll be next year.
yeah, and that's the thing is like, I just don't know. Most of my justification really for the salary increases is that even though our numbers are down, the intensity and complexity of the cases that we are encountering are time consuming. And I think that that's also kind of playing in with the nature of the FOIA requests, which also is overlapping into the time and attention it takes to analyze these reports, weed out what is necessary to disclose publicly. Again, we have to consult sometimes with other agencies because there is, we cannot commingle reports or have a confluence of reports or share other agency reports. So that's primarily the justification for my justification, if you will, for asking for the increase in salary and the additional deputy. But again, to perhaps answer your question, if there is a FOIA, I don't know of $25. You guys are probably generous, but it might need to be a little bit more than that.
Right.
Based on
I
the
think-
size of your department or what you have to run.
Right, I think
Right.
that was just the amount that was given by the Board of
Sure.
Accounts.
Sure,
Up to
just a
$25
number.
per hour.
Right,
And
per
then-
hour.
yeah,
Okay,
per
yeah,
hour.
that's great,
That's
rather than
good.
just a request. Yeah.
Want to see what other counties are charging also. I don't want to be known as a county that, we're the only one around this area that's charging.
Sure, I wouldn't want to be too cost prohibitive either. I wouldn't want to be too cost prohibitive. But they really ought to the requester probably ought to really examine what they want and how much they want.
Yeah.
Right, and again, but also we are bound by statute. And other internal, interagency regulations and practices of what we're able, that's not going to guarantee someone a full undisclosed report. You know, the next of kin of the deceased and law enforcement, other related agencies are usually the only ones who are privy to a complete, total, unredacted report. Okay, cause, manner, where, when, who, how, what. That's really all I am obligated to release. Again, methods, practices in discovering these, the elements of these reports, we're not able to disclose those. So,
don't tell me, my last question.
No, no,
I remember
here
this
for it.
coming up before, and I just want to protect the county in case we certainly were in a position, as we all know, association with business and some of the blessings that come in cost savings with some in-kind support because, vehicles there, let me
Yes,
just
yes,
use it,
yes.
we know. The fuel continues to not bug me a little bit. I just want to make sure, for example, like at mid-year with 3,000 budget and you hadn't turned in
Sure.
$1, I had been spent. I just want to make sure, kind of like with the sheriff's department cars, we gotta have mileage logs.
Yes.
We need to know at the end of the year, Ben needs to know, if a deputy is far beyond
Right.
miles on a vehicle that
Right.
he should be,
Right.
not taking advantage of lower cost fuel opportunity. I just want to make sure if you
Absolutely.
weren't in this position and somebody else, we gotta know realistically what we
Exactly what
really
you're
have to
dealing
budget
with.
for fuel. And
I-
in fairness to you, paying you, so
Yes.
can we keep a monthly
We-
fuel log and maybe? turn that
That's already been,
quarterly?
that started July the 1st,
Mm-hmm.
with a logging, of who and what and where. The how long is, a little difficult sometimes because it's like, well, what do you allocate? Do we need to allocate this on a specific case? Or again, just to give you an anecdotal, right, just give you an anecdotal, we may be called to a scene. And we might have to wait for a state police crime lab technician to bring a camera from Fort Wayne. Literally. And they're driving, responsibly, but under emergency conditions. So is it it's not exactly protocol, I don't guess, to wait, but we have left a member of the department at the scene along with law enforcement. So, I mean, just giving you, that's just an anecdotal. Sometimes we show up and it's very plain and simple, but sometimes the hours get a little, but our activity level, we are, documenting that so we can give you, and that's part of a larger presentation I hope to give you midterm, or at the beginning of a new council, for plans for the future to possibly stand up a new facility to give you an idea of what personnel costs really would be, what it really would look like if it had to stand alone, if we'll just hypothetically say this, if Morgan and A Funeral Center, which is currently hosting the coroner's office with equipment and facilities and so on, was not there, or Norton's King's Daughters, or the EMS, or Welty's, or whatever, just to give you an understanding of what you're looking at on any given year.
Standalone corners.
Yeah, exactly. Yeah, so that is something that has been, that is going to be it should have been a first year goal to do that, but you just really never know what you're getting into until you're actually doing it. So,
It's just one that. comes.
yes.
Just one, he did, have a good.
Yeah,
idea of
and
what's
again,
at
a
today.
lot of that, it does, I would like to say that it comes out in a wash. It does not come out in a wash. I do believe that the taxpayer is ahead under our current system. But that current system is not indefinitely sustainable. Just due to everybody's getting older and things change and temperaments change and personalities change. So that's why I think I'm going to introduce a proposal to the council at some point in time about an alternative system to what we have been doing. Again, I was talking again anecdotally. I wish that the old days were still here when Alice Jackson was the coroner and she had a professional relationship with King's Daughters Hospital and the death rate wasn't high and We didn't have the complex analysis of deaths that we do today by public interest groups and other agencies and law enforcement, but things have gotten more complicated. And so there is a necessity to professionally silo ourselves. And so this relationship, as it has been over the generations, really, probably needs to be formalized in a more professional sense.
So to Heather's point, kind of, my question is, your flexibility for things like toxology, autopsy, and forensic and stuff like that. Your flexibility would be open to achieve your requests.
Yes.
Okay.
Depending on nature,
That's all I needed.
yeah.
And we can't predict tsunamis.
No, I know.
Right,
What if
yeah.
this,
Right.
So Josh, in that proposal that you talk about, is it going to give us some type of idea of what it would look like if we had like a standalone and not relying on in-kind donations to use a facility?
Yes, fairly comprehensive from personnel to practical concerns such as autopsies and the running of an office, if you will, a facility, hopefully even almost down to electricity. There are several neighboring counties that we can study from and learn from and make adjustments. However, we have a hospital here. And not all of our deaths are Jefferson County citizens. But if they die in Jefferson County, we're responsible for them. Okay, and for their cases and so on and so forth. Again, it's kind of, it's hard to compare really apples to apples, really, right? Scott County might be the closest one we could probably look to. Carroll County, Kentucky would be another one that we could look at. But my future proposal would include, it would be fairly comprehensive from staff, equipment, vehicle, insurance, all of the above. It would probably make better sense financially and in terms of best practices for our county to have a standalone facility equipped with a vehicle and probably 2 full-time staff members. I see the state of Indiana eventually transitioning to a medical examiner system as opposed to the coroner system as it is. I don't know what that would look like. This is something that I see off and above, and probably this is all speculation, but a decade away, if not a little bit more. But the conversations are being had on different levels.
So the medical examiner, would that be like a regional type?
It depends on how, what system Indiana would adopt. Neighboring states do regional, Kentucky does a centralized system. Illinois, I'm not exactly sure what their system is. I think it's still a county coroner system. Ohio, I think, if I mentioned Ohio, I'm sorry. There's a hybrid in Ohio between coroner, medical examiner. I think that's would probably be what Indiana would do, but again, it's just speculation. I just want to start having the conversation of standing us up in a way that we're prepared to be folded into something that's coming down the road. But again,
the other thing you think about too is, the hospital, the reliability and being, if we would use their morgue, that's kind of a.
Yeah, there is a professional.
Getting into the same.
Yeah, there's a professional understanding that we have right now, that with utilizing some of the resources at the hospital, not just refrigeration, but also x-rays, and some other processing, for our purposes, okay? As opposed to, driving, an hour and 45 minutes away to Hamilton County. And, which, again, some of these, there are, again, anecdotal criticisms that I have of everything, even myself, but, we can get by right now. We're good. We're good for the next several years, but it does have a shelf life probably.
Yeah. And I think we've seen that,
Sure.
especially like your predecessor, wondering who was going to fill that role.
Yes. Unlikely that I thought that I would be sitting in front of all of you today, ever.
I know.
Sorry.
This was not on my bucket list, but,
We appreciate it though.
well, I have, these words are escaping I have enjoyed, the responsibility in some aspects, but,
Reported that.
yeah,
Yeah, I know.
it is recorded. I have enjoyed the response.
It'll be on you.
I have enjoyed the responsibility in some aspects. Others they're horrible to contemplate and to talk about. But so that's
I think it's safe to say that you got drafted. Railroaded.
yes. There's others that would involve, probably a handgun to head and all of that. And
I remember us
else,
having a conversation about
right,
3 years
well,
ago.
I'm authentic, as everybody in Jefferson County knows. I really don't have much of a filter. I'm doing pretty good today.
Yes, you.
So would you please, and I think I speak for all of us and probably the citizens of this county, please give Rodney and all your staff our heartfelt thanks for what you do for the county. I don't think the average taxpayer realizes what you guys are saving us. We're using your stuff, your facility, and that's not a given. We're not entitled to that.
Sure.
And so we appreciate it. We sincerely, and not for everything you guys do for the county. When people go into your office, they feel like they're your friends. There's some comfort there. You guys do great work and we appreciate it. And we appreciate the use of your stuff.
Thank you.
I will say, just, pivoting off of Heather, that I appreciate your forethought to start doing a log.
Yes, again, in preparation for today, it's like, we didn't.
And that's just
Like,
one
we
more thing
didn't,
that you have
we
to
didn't
document.
do it, right? And I thought, so it's going to be it's going to be July to, June, but,
Yeah.
it'll still be a snapshot. And we'll work on trying to improve that.
Yeah.
The recording and reporting process.
And that
Again, not just to have a more accurate picture for our annual hearings, but to plan for, the future. Again, I still think in a sense that and again, this is referencing this proposal that I'm going to supply you all with eventually. It may make sense for you to spend money one time and transition to a full-time, fully compensated, 3-person staff. You might be money ahead, over $175,000. You really might be.
Cause I don't think you guys ever use that fuel line. You're donating your,
We don't do it as often as we should.
And we should,
Maybe
right.
myself.
Well, yes, but again, that is that part of the element I'm saying is like, it is a complicated. It is, this department is not necessary until it's necessary, and it's very necessary, and it is appropriate to scrutinize it. However, day to day, it's easy to simply put it in the later box and to try to reconstruct all of that is, I feel inappropriate.
Mhm,
You know, it's not exactly transparent.
mhm.
And so hence the reason for starting recording that. So,
Who are you with? I know.
yes, I don't, if we're finished with, I would like to introduce, so behind me, I've been forensic intern with us this summer. Her name is Claire Sly. She is in her third year at Western Carolina University, and with her graduation being next May. And she is pursuing an undergrad in forensic science. So, for forensic pathology, excuse me. So,
Good to meet you.
Good to meet you, absolutely.
and Claire has acquitted herself very well. She has assisted me in preparing for testimony. She has assisted me in the practical application of our responsibilities in one of the more difficult cases that we have had this year. And she's a a compliment to her family and to our community. And I don't know if her path would bring her back to Jefferson County, but I think we've hopefully strengthened her ties to it. So good. Besides just being,
I was gonna ask that. I hope she sticks around.
yeah. She might be able to do autopsies for next to nothing for us. This is an
I thought you were gonna say for me.
This is- This is an investment in the future, really. I mean, if we could do a one-stop shop. I mean, that.
Claire, when do you return to school?
This Thursday.
Oh, okay.
Yes, so I asked,
For a few more days.
I asked, well, actually, she's attending today. I wanted her to experience the fullness of what it means to be, you know, in the biz, if you will. So, yeah.
Has he been making you do all his work? I mean, just you go ahead, full disclosure.
He's been a great teacher this summer.
I bet that's true. But yeah, he don't need any bigger ego than what he's got, really.
Look, it is an unpaid internship, but the compliment cost me probably somewhere.
Yeah. And then Lisa.
Yes, and Lisa takes care of managing a lot of our and making sense of a lot of our incoming toxicology reports, autopsy reports, and curating all of that for us to be able to appropriately sign death certificates. We've, again, under web administration, we've not had to have any amendments to a certificate or anything of the sort. So, you know, I don't know about the predecessor, but you know.
Josh, you might not be able to tell me this, but deaths from overdose, are those?
Down, I
That's so good to hear.
I can't
I
exactly,
know that.
that will be in the
Is it trending
supplemental.
down?
It seems like it's
It
been a
does, okay, and again, anecdotally, big word that I use all the time because it's unfortunately necessary. Anecdotally, it does seem to be working. And awareness seems
good
to
to hear.
be working. Suicides, are, down until, you know, again, it seems sometimes that they're not.
Knock on wood.
The intensity of these cases, leave impressions, but the numbers seem to be trending.
Trending in a good way.
Yes, downward. And the supplemental of these things that we are participating in since last August, I will include a January to January total of these on a spreadsheet for you guys. Okay. So,
Thanks, appreciate it.
Thank you, Josh. And I always know when I pick on Josh, it's coming back full.
yes,
It's coming back tenfold, so I'll brace myself.
I'm just Josh.
It won't be so public though.
I hope to be, I hope I try to make myself as approachable to anybody and everybody that is involved in what we do. As I brought this, actually, here was our piece of paper. 34 autopsies, yeah, that from August to August, Oxman 2. Yeah, our total deaths in 2024, total deaths that our office responded to was 140. 2025 111. So, and so far this year, we're, 3 ahead of the actual date
Okay,
of
like,
August the 11th. We're 3 deaths ahead of where we were in August of last year.
Mhm.
So it does seem to be trending down. So
but then you have November and December.
we do, but again, prayer, hope, good vibes, oh, and awareness. Again, before we leave, I know I mentioned to you last year that there would possibly be a collaboration between the sheriff's department and myself. That did not happen over New Year's and prom. But we are planning on collaborating on a video, if you will, to raise awareness, to make better decisions on those occasions. Partly, and most of it will be in good taste, but the message would be to our young people specifically. And also, we're continuing. The sheriff's department had a presence at the county's last suicide walk. I know, and everybody's planning on making an appearance and spreading that as well. Also, our county hosts the suicide prevention hotline on our department's page at the bottom, and other resources that are available to people in crisis. So, yeah.
I have
Oh,
one other idea.
yeah,
and
yeah,
email you.
oh, sure, sure,
Later about
sure.
community awareness.
Yeah, there is one other item, and it may cost money. I don't know. I probably would receive some blowback from this. There is, since we are trending downward on overdose deaths, I don't think we cannot let up on spreading awareness in our own homes, out and about in the community, being direct in our conversations with people, that those are decisions that do not need to be made for their well-being. There is a sign, a colleague of mine in Kaskaskia County has a sign. And I'm not really comfortable with this as of yet. I need to consult with him about their decisions for placing this sign. But there is a sign that raises awareness, and it's at basically the county lines and some other prominent points in the county that talks about deaths due to overdose this year. And there's a number, and I think they go out and they attach a number.
Mhm.
It seems like that's not a very good billboard for our community in terms of like tourism. And I'm being very transparent to this thing that's in the middle of the room. I wouldn't want to be otherwise. However, I feel the lives of our citizens are just as important as the considerations of our appearance to the outside world. Because it doesn't just affect one class of people
Mhm.
at all. It
Mhm.
affects everyone.
Mhm.
And first and foremost, it affects law enforcement, and it affects our office in a profound way
Mhm.
that no amount of funding or budgeting could ever cover or repay.
Mhm.
So that's something I'm going to be talking to some colleagues about. Again, just keeping the foot on the pedal of the awareness aspect of what we do. Thank you, Josh. Anything else?
No, thank you.
Okay.
Thank you.
All right. I usually talk too much, so thank you.
Claire, good luck at school this year.
Thank you so much.
I'm always so proud to see my former students that have done so well despite having had me as an instructor.
So she was,
Yeah, I had her in junior high and high school.
no kidding. I hope she comes back
Or-
here to live.
She was in the pathways to engineering program a little bit. And then she lecturer of that, and she went the medical.
There you go.
It's good. Then figured out.
Congratulations, Brent.
Oh, thank you. Here's a impact report.
Wipe his nose out when I get there, budgie. Late last night, no, I wasn't working, I was on my hospital computer. And I had someone call and say, I never got a reply email from you, and it had gone into a spam folder. So I dug in that folder, that, I had an email from you, kind of county email, but it came to my hospital email.
Oh,
And so I got it at 11 o'clock last night.
okay.
So I forwarded it to my other email that I used for the county, so this will be in discussion today, but I just want to apologize.
Oh, no.
Didn't get that till about 11 o'clock last night.
Thanks for seeing me today, everyone. I'm Britt Copeland, in case you don't know, I work with Extension. Here in Jefferson County, we have a really awesome extension program. So you probably all are familiar with our most visible program, the 4-H Fair. 4-H is a lot more than just the fair. I put together a little impact report with pretty pictures so that you guys can kind of see what we do, because pictures are a lot more fun than numbers and listening to me talk and that type of thing. What Extension does, it's been a government program since about 1914 with the Smith-Lever Act. And what we do is provide educational programming across different thematic areas in health and human sciences, ag and natural resources, and then 4-H youth development. So in Jefferson County, we've previously had 2 educators. Myself, I specialized in 4-H and ag, and then Savannah, she specializes in HHS and 4-H as well. So this year we've had a really awesome year. We're continuing our in-school programming. We're reaching every 3rd grader in Jefferson County, not once, but twice, once with Ag Day, and then another time with our 8-week Junior Master Gardener program, which is a partnership with the schools, the National Community Grocery Project. So we actually have gardens in every school, and we do an 8-week intervention where I teach the kids not only how to grow their food, but how to eat and cook their food. So we do little veggie taste tests, and then they do a celebration salad. We also do a lot of other in-school programming, such as Captain Cash, which is a financial literacy program. We do youth mental health first aid. We do nature teaching, which is more natural resources. And then the sustained growth page is our traditional 4-H programming. I'm constantly impressed with the 4-H program here. We have over 458 4-H members in Jefferson County that are a part of that. And then it's all supported by 94 volunteers. And you all are community leaders. You know how hard it is to wrangle 94 people into doing one collective thing. And we do that every single year. So I'm always impressed by that. This year we had over 2,300 entries in the Jefferson County Fair. So all of those kids, it's really impressive because they're not getting a grade for that. They're choosing things like aerospace, like health, like woodworking, like electric, and they're doing that electively for their own extracurricular educational benefit. And then, of course, it continues to be an economic driver for Jefferson County. This year, our livestock auction brought in $511,000, which is incredible support from local businesses. And we're just eternally grateful for all the volunteers that make those connections and all the businesses that see the future of youth and of youth in agriculture. Because it's really, when you sell a cow for that much money, that's your first car, that's your scholarship or part of college or trade school. That's a real impressive way for youth to earn a nice little dollar there. Then the next page is our Beyond Ready to Lead. So Purdue is shifting into a regional model, and I'll get to that. But we have been doing regional programming for a long time. So at the bottom there, we had over 100 youth travel to Jefferson County for programs that our local staff put on.
So we did a Beyond Ready for Leadership program at Hanover College where we trained kids to be leaders and helped them develop a project or a program that they could bring back to their local 4-H program. We partnered with Ivy Tech Madison to do a experienced vet science program to kind of highlight their new teaching school. And we did a bus tour of 4 different businesses in Jefferson County where they could find employment, plus the big dairy in Greensburg. And then we did a Beyond Ready to Show livestock that had over 120 kids come to the fairgrounds. So we're trying our best to make Jefferson County a local hub, and we're bringing in people to have more of a regional focus and a regional impact. So we're really proud of that. And then the back page has a lot of different, just smaller programs that we've done. And so why we're here today, Purdue Extension is transforming from the traditional county-based system into a regional-based system. They're doing that because of financial pressures, and like I've said, Extension has been around for 100 years, and in 100 years things change. If you're not familiar with the Extension funding model, it's a 3-tiered stool. So we get money from USDA NIFA, we get money from the state of Indiana through the Heartland line item, and then we're supported generously by county governments. And so those first 2 legs of the stools, that funding has remained pretty much flat for 20 years. And obviously prices and salaries have not remained flat. So they have shifted into more a regional focus, and Heather emailed out this budget flyer to all of you that has the tiers on it. So what that is going to look like for Jefferson County. We won't be losing any services. I am moving into a regional operations leader role, which means I'm covering about 4 counties. And then we are getting an additional staff member into our office. Her name is Jill Richards. So she's going to be the local 4-H president. 4-H obviously it's the most important thing to me, and it's very important to Purdue Extension. So we will be maintaining a local 4-H presence in every county in Indiana. That might look a little bit different, but it's going to be supported by our entire staff. The different program areas such as A&R and HHS are going to take a more regional focus. So Savannah is going to be shifting into a full-time A&R role, which is a lot more of her bailiwick. And our HHS programming is going to be supported by educators in other counties. And there has been a significant increase in contractual services. So if you see on this population tier, they have implemented a tier for all the counties to have a more uniform approach. This is being implemented all over the state of Indiana. Some counties are seeing significant increases like we are. Other counties are seeing minor reductions in their contractual services because the way that has shifted over the years has not been very consistent. So my predecessor, Lonnie Mason, as everyone knows, is very famous, was a very, very fiscally prudent man. He ran a very tight budget, and I applaud him for that. So our budget has been pretty small in Jefferson County, so it's been more equivalent to Switzerland and Ohio County. We've been paying about the same in contractual services. So that is contributing. That's not to say that it is his management, it's Purdue's management, but that's kind of the comparison that you could make. So in this regional model, we're going to take a lot more emphasis on how employees' strengths lie and how they can be best used. So instead of someone coming to me and I'm figuring out why their grapevines are dying, we're going to use more of a regional model and bring someone in from another county that might have that expertise. So the same thing we're not going to train every educator in youth mental health first aid. We're probably going to send me to Dearborn County. As a result of that, a lot of things are getting shifted. One of those is we're taking county mileage out of the budget for all counties. So we've reduced that by $3,500. We're leaving $500 in there just for county staff. Sometimes they assist us by taking state fair projects up to Indianapolis like they did yesterday, that type of thing. Our contractual services, I took a look at the budget and I cut everywhere that I could. Postage, took some out of our intern, that type of thing. And I was able to get the increase in contractual services down to about $67,000. So I know that that's a very significant increase and I'm aware of that. We're looking forward to continuing our partnership in every county and of course Jefferson County in particular. So yeah, I appreciate your guys' support. It's always great to see our county leaders out at the fair. And I know a lot of you are out there and we enjoy that and we enjoy being a community partner. We try to make every opportunity to maximize our impact, working with schools, working with local nonprofits, hosting things at the fairgrounds, that type of thing, because it's the connections that make 4-H and make extension so powerful. There's only going to be 3 full-time staff members and our 2 support staff that are county funded. So that's not a big team to make the impact that we've made. Last year we have a reporting system. And so I report in every time that I do a pollinator workshop for a kindergarten class, or I do a junior master gardener, I do mental health. And last year I had 4,533 youth contacts and 1,100 adult impacts that I reached with educational programming. So I do think that it's a valuable service for Jefferson County. And yeah. Do you guys have any questions?
I just have one. Remind me again what counties there's 4.
Yes.
Switzerland.
Ohio and Dearborn.
And Dearborn, okay.
When Brett came to my office and we talked about this update, it was my idea to I was afraid to put it all in county general, knowing the restraints that we have. So what I did advise him to do is we went ahead and bumped the contractual line up to 60,000, which kind of rounds off where we were. But I also budgeted the entire 140,000 in lit. If we were to decide to take it out of county general, then that 60,000, that would be out of county general. But also by moving it to lit, it's a little easier to keep track of in the sense that that's where our EMS contractual is. That's where our animal shelter expenses, and it would just make those contractual and interlocal type items uniform.
Well, we're still looking though at, I'm fine with the 60,000 at 58,823. That really now the contractual requirement being 140. So we're still in 80. I know I did the quick math. You cut the budget by 6,700, which is appreciated, knowing that we could drop in posted. But the contraction amount's $80,000 more.
Yes, it went from 58,000 to 140,000. Yeah.
We certainly appreciate the $6,700 cut budget, but yeah, that's substantial.
So that still puts us about 74.
Yeah.
Right?
Yeah.
That's why I
Different
said
three things.
it.
And the printer
Yeah.
is still 6,500 because we're
Yes.
required an additional 6,500.
Mhm.
And we have a not-for-profit request from 4-H along with, unfortunately with that, we have this much request and this much to give. So we obviously decisions have to be made for that. So that's a piece of it too.
Which that's technically a different board.
Sure, right, sure.
The
So impacting
agricultural
4-H
board.
labor extension.
The fair board is.
Yeah. Extension is responsible for 4-H in every county, so we're their governing body.
Yeah.
But I'm not going to tell them to take away their request. Obviously,
Sure.
that's up to you guys and how you want to allocate county money.
And I know it is mind boggling, yeah, that obviously the matrix they use and, knowing that some counties in their contractual required amount saw even a small decrease, and we saw an $80,000 increase.
Yes, it is very significant and it is, very sudden. I definitely.
Is there a reason why they didn't share that among all the counties?
What do you mean?
That additional increase?
Communication or
Oh, all
a
of it?
different way to redistribute.
Yes,
Who's
right,
paying what?
exactly, that's where I was going.
I think I understand the question, but, so different counties are paying different levels of contractual services. So a lot of other counties are at this 140,000 or more. And, so like Switzerland and Ohio are paying 55, 53, and they have a much smaller population than we do. And then there are, other counties that have similar populations to us that are paying more than that 140,000. So when they looked at it from a system level, campus leadership thought that that was the most equitable way to put everyone on the same tier instead of relying on historical agreements that have been made person by person over the decades. And this is a service-based contract, not, contractual services is not tied to individual salaries. So that was kind of a reason in the past for those contractual services to kind of get in different places. They were adding staff members and counties were paying more for that person's salary, and that hasn't been the case for several years, and that's not the case under the regional model. The regional model is paying into a system, and of course, we have access to the entire Purdue Extension system. And that includes stuff like our Purdue Agriculture Centers. So we have a PAC system. So in Butlerville, we have CPAC. And what those PAC systems do is they provide on-farm research opportunities. So in Butlerville, they do things on like edge stripping, conservation, and then it's mainly corn and soybeans. So professors test their so is a nitrogen fertilizer really worth it at this level? And then they share that information with farmers. CPAC Field Day is actually coming up on August 26th. If you'd like to go, as a free program. And that's one of the opportunities that farmers can get free pesticide applicator credits for their license that they need to spray fertilizer on their farms. And then there's other PAC systems like SciPac all the way in Du Bois, and it focuses on, it's a beef cattle operation, and then they have like a animal diagnostics laboratory. So if you have your sheep or your goats die, you can send them there to be autopsied for a nominal price and that type of thing. And then we have state and campus specialists, and of course, the Indiana 4-H office that supports things like the Indiana State Fair going on right now. So we have access to the whole system, and the idea behind the regional system is implementing more of that philosophy to use educators' skills better across county lines.
Thank you for that.
Yeah. Thank you for your question. I know it's it's not a fun number to look at.
We're crunching a lot of numbers.
Yeah. And I appreciate the difficult environment you're in, especially this year. So.
Can you forecast the improvement that you foresee from the regional model in terms of folks' access to help, as opposed to what it was to what it is going to be?
Yeah.
I'm just looking what's the value added for $140,000? You know, I mean, as much as you can foresee it,
Mhm.
anticipate.
I'm not good at predicting the future, but I try. The idea behind it is breaking down a lot of barriers. So an example that we have in Jefferson County, shooting sports is very popular 4-H program. We don't have a good range or a good volunteer. We don't have a volunteer setup for to support that in Jefferson County. Obviously, the schools have a lot of great archery teams, but 4-H shooting sports, it's muzzle loading, it's rifles, it's pistols, all of those different things. And so what
Do you
we've
think that
done,
that maybe is because of friendship?
yeah. And so what we're getting to now is I've had a couple of kids say I want to compete in the rifle competition. And so I'm sending them to Switzerland County. And in this regional model, we're going to be able to make that a much easier process and support Switzerland County more, saying, you know, like, hey, we're going to do this, but you guys have a good shooting sports program. Let's send more of our youth over there. In the past, it's been kind of like they're Jefferson County 4-H members. They can't go over there and compete in the Switzerland County Fair. And under this regional model, we're going to say, you know, we need to have all of these opportunities available everywhere. So shooting sports is not something that I have an expertise in. So let's use our neighbors, Switzerland County, and build up their program. Just like Switzerland County sent a lot of kids over here for our vet science. So we're trying to make that regional program work more. It's going to be especially helpful with A&R because I do get a lot of A&R clients. Why are my grapes dying? Why are my trees dying is something I get like 1,000 times. Everybody loves their trees. And I'm not a forester, obviously, but we can connect those people better in this regional model. Dave in Ripley County is our resident pond guy. So if I've got dead fish or send people sending me pictures of dead fish, I can get Dave on the phone and I'm like, why are these fish dying? And they'll say it's, you know, winter kill or, you know, whatever.
Sure.
That type of thing. And this has been pilot tested. So they were pilot testing this in the West Central and the East Central areas. So kind of like either side of Indianapolis. And they did see larger reach with those programs. And it's the same type of reach that I kind of highlighted in that page with the Beyond Ready thing. We have 94 volunteers, but as you know, kids today have insane schedules, and so it's hard to put on stuff that's, you know, it's one thing when you're putting on a class in a captive audience, and it's another thing to recruit all of those kids to come on one Saturday when they have basketball, swimming,
Trap wall, yeah.
yeah, all of those different things. So when we're able to use that regional model and I can say, one Saturday, I got 110 kids to come. That's gonna be the issue. That's gonna be the benefit of that.
Yeah.
And it's gonna be good for Jefferson County when I can say where Jefferson County is a regional leader, and we're already starting that. We're going to have the Southern Region Livestock Skillathon. It's a FFA competition on September 8th, so a couple of days before Ag Day, and that's happening at Jefferson County Fairgrounds. And you know, we've seen amazing improvements at the fairgrounds, so making that more of a regional hub is going to be a big focus.
It's good having centers of excellence. It's a draw.
Yeah, right.
For adding the extra staffing in there, that building was not built for that. Is there room?
Mhm.
Okay, you guys have found room for that?
Yep.
Okay. I didn't know, whenever it was created, I know it was very specific.
I'm moving into the closet.
I heard that.
They go out back.
It's probably right there.
Is there room for you though?
Yeah, that's what I was.
I am
wondering.
happy
Okay.
in my closet.
Seriously,
Like,
I'm in for a desk.
He's cozy.
I'm in a vault and sometimes it's a little restrictive in what you can
Yeah.
do sometimes.
I mean, I think
You
I'm
know
gonna
how I
have to
make
like,
Carry chairs to my desk.
I think I'm gonna have to come out and like touch some grass
Yeah.
every couple hours. but I'll
See
be fine.
daylight.
No, I'll be
You
fine.
know, you can get those panels that project like UV rays and pretend that
Mhm.
you're outside and.
Yeah, a little sunlight lamp.
Hang murals on the wall.
Yeah,
Palm tree.
Is,
That'd be a project for the kids.
yeah,
right, there you go.
You never know what you're gonna get.
is there a chance that the Purdue system in a year after starting this new program will reevaluate and perhaps look to help out the counties of Indiana a little bit more?
I don't know. They have said that this will be this is a lock-in for 2 years and they're doing their best to create a sustainable system that's not going to increase year after year. So in the past year, they've been kind of like, okay, it's a $2,000 ask this year, it's a $3,000 ask this year. They're saying this is the system and this is our tiers, and we're only going to evaluate on population. So we're going to look is if your population increase, you might go up to the next tier. But unfortunately, we are at the well, unfortunately, we're kind of at the bottom
Mhm.
tier of that 140,000. So it shouldn't increase further in years, but I'm not Purdue. So they are being very conscientious of that ask. But and extension in 4-H Indiana, if you look nationally, is very special. We have a very strong 4-H program in Indiana, and there's been a lot of counties, a lot of states that have went to this regional model sooner. And Purdue Extension is one of the last holdouts, and so that's part of the reason that they're in this financial reality, because they recognize the impact and they of 4-H programming having local connections, and so that has been impacted.
Kentucky is UK, obviously. Does Illinois and Ohio have the same?
Yes, yeah, our regional setup is not the same as those counties, but Illinois,
Do they have a university, same
mhm,
thing that
yep,
leads 4-H?
yep, Ohio County or Ohio the state, Ohio County, Ohio State has a more system kind of towards ours. Illinois is, they've got one educator for about 8 counties. So they're a much more pared down system, so,
Well, that's a stretch.
right.
I was gonna make a comment how your extension office is full of personalities. But I've now realized that almost every office in county government has personalities. And
Yeah.
That's what makes it kind of fun and refreshing.
Mhm.
I was thinking though, on nice days, you could just take a boat to all your counties.
That's what I was thinking too, like just get a houseboat and
Just go back and forth.
just float up and down. I don't think that's fiscally responsible, but we'll see.
Thank you for all you do.
Yeah, thank you all.
Anybody have any more questions? Or
No, but be comfortable with
all right, sir. Mr. Pickens, he's not gonna come in.
He is not.
He's not gonna come in. Okay.
No. He relayed the message to me that everything.
Thank you, Brett.
That everything is the same, that when, vehicles are looked at, it would be a request of his to look at a vehicle for, the building inspector, which I believe if we look at the mileage between building, if we look to see how much mileage went out last year, it's probably getting a very high amount whenever you look at everything he's doing, considering that they're also picked up the town of Hanover.
Right.
And, so I think the commissioners have a request for a vehicle, and at that time, maybe just think about the possibility if there was one, maybe two, and like the need, obviously, he wouldn't need like a 4-door, 3/4 ton pickup. It's typically just himself that's going to these sites. So
I suggested to him 2 years ago, get Josh a vehicle,
mhm,
maybe one with the sheriff.
right.
Like a
Well, and so I know the county highway recently just purchased a Chevy Colorado.
Mhm.
And I think it was at a reasonable cost. It's fuel efficient and
With
I
as
would
many
look
trips
at
as
it.
he's making back and forth, that mileage amount does not surprise me.
right, and you know, at the end of the day, like we are asking him to put all that wear and tear on his vehicle. He is getting some back, but it's probably
wear his
the way that
vehicle.
vehicles are,
Yeah.
it's probably not.
I wish I.
Well, when I suggested it to Michael, he says, oh, Josh just loves driving that big diesel around.
I put 30,000.
Yeah, no, and I
on my
think
car.
diesel prices like
Yeah.
between
And I only made one.
him and between the maintenance,
Personal.
that's definitely been a, our 49 cents per mile is not really cutting it
So
whenever
to
you
me,
have,
mileage reimbursement.
if you own a diesel truck and you're getting reimbursed 49 cents per mile. So,
Yeah,
First for maintenance or something.
I know, oil changes.
and we're not even giving our maintenance mileage, right? Well, he.
Not the national
mileage,
average?
but not a maintenance, like garage. Right. But, no, we do not do, we do what the state, so our policy is what the governor has, which is 49 cents.
See, I get 70,
Right,
71
and you
something.
know, if you turn in on your federal income tax, I think it's almost like 80 or
Yeah.
if not more.
Mhm.
So, there's a, you know, even I make a couple trips to Indianapolis a year and different things like that, but 49 cents really doesn't
Mm-mm.
touch. Nope. Unless you have a small car, 49 cents might touch the maintenance. But I don't know.
Yeah, I think that's a good idea. I would rather drive a company car than my own.
Mhm.
And then
I think that would be,
you can do.
in my opinion, like, I think I remember Ray suggesting that, and, I mean, if Josh were to ever leave, I mean, there are a lot of people that don't wanna drive their own vehicle.
So that is their singular request. At lunch, I'll probably go down, I need to print minutes for tonight
Mhm.
anyways. Is there any, I'll probably sit down and do some work. Is there anything you guys want me to update so far? No, not yet.
No, I didn't print any copies of the agenda, nor, I mean, I have it on my computer, but,
Right,
And I
I,
looked, the agenda was not on
or
there.
was it?
it's posted, but I must. have
Right,
forgot
right.
it
I
was
I mean, we had like 10 attachments, so I was gonna
Right.
say, I thought I
So
was losing my mind.
this is the agenda and the newly posted one has the library scratched until October.
October, okay. Cause I saw that and
You're welcome. So basically, we
I was
have,
confused,
uh,
when I saw that.
Board of Tourism,
Uh-huh,
insurance, which that'll be kind of a budgetary item they'll be discussing. And then Kevin Fry, the commissioners recently passed it's part of HEA 1461 that he has to have a capital improvement plan and give money to the highway. So, we have all those documents and they have already been reviewed by, Pat and by Mr. Jenner, because he also had to prepare it for the city as well. So
Mhm.
both attorneys have worked over
Yeah.
this.
Every township trustee has to have a capital.
As of
improvement
last year,
plan?
they had to have it actually turned in
Right.
last year.
But I think because he has a surplus of
Yes.
funds, this is why he has to do it this way. And he has to actually turn 30% of his surplus, I believe,
Mhm.
over to us. And we have to keep it in a separate fund. And then Jason and the guys out at the highway garage tell him what projects need to be done. Him and his board select a few projects they would like to fund. And then we pay for it out of their,
And if I understand that
Surplus fund.
surplus, whatever roadways are within that township, that's where that money is allocated.
right, on those projects, yeah.
Correct, correct.
So like Jason will say, this culvert needs replaced here, this needs, like
Mhm.
whatever needs to be done for that
Mhm.
amount.
That's the excess from his cumulative, from Kevin's cumulative fund.
Yeah, for instance, like Monroe Township where I live, there was a surplus. That board decided to invest it into the fire out there, and make some improvements. They actually have a secondary building that is going to be, so that surplus for that township, there was allocation for that, so there wasn't any surplus.
Right.
Because that board allocated to cemetery or to the fire, to new equipment, building, that type of thing.
Familiar bit was what the Smyrna Republic did, so,
And I think that they did the same thing.
but their house weren't as head first high.
Mhm. And so
Madison
for
Township
Corey
makes sense, 'cause
Thomas,
it's the most populous
Yeah.
township, so.
yeah, and when we went to Fort Wayne in June, I got to talk to Corey about, where was his capital improvement project. So same thing, let's focus on fire, parks within his township.
Right.
And there wasn't a surplus, so.
Okay.
While we have some downtime, do you guys want to look at, if I can get. Oh. well,
Better go
we
for
don't.
downtown.
So cemetery board,
He's used to.
they do not typically present to us. But I have spoke with Alan Manning on their request. They typically always ask for the $100 in office supplies and $29,500 in mowing. And that has not increased for a very long time. And he has asked for $33,500 in maintenance. And that is due to a roughly around a $6,000 project they have planned for one specific cemetery. He didn't go into detail. He was on a missions trip when we were doing this, but I did go ahead and include that amount in, as it is a minimal expense, but this is a tax driven fund.
Mhm.
Now,
And he didn't indicate which cemetery.
he didn't, I can email him and get more
If we should,
information.
cause maybe we, could go back to the township to see if they would consider allocating. And, cause their budgets are due. Like now, they're having their meetings and submitting their budgets, maybe we could get in front of whatever township that's in. See if we could get some funds out of there,
There you go.
just a thought.
Great.
Uh-huh.
We're supposed to take.
Not Alan's email.
We're supposed to take care of cemetery to go to the cemetery.
They can't, or you mean the townships?
Yeah.
They can,
Okay.
yeah.
Okay.
Like any, parks, cemeteries, fire, or anything like that. I think.
Spoke about this movie. Individually spoke about yesterday in this meeting.
We've already reappointed, a previous,
Are you guys ready for Mr. True?
well, we had a renewed.
Okay, I have him.
I think so. I'm pretty sure because I turned it into Tabitha.
I'm just throwing that.
There's the.
And so we were.
Title around loosely. Yeah, I was pretty useless there. You don't want to mean anything anymore. It's like saying Mr. Fly. Or, I'm back to it.
Anything ballot related or adding people to the, no, she resigned and I appointed.
Typically, the cemetery doesn't ask for too much of anything.
No. It's a very,
She worked over
considering
at-
how many cemeteries they do maintain, it's a very minimal.
Several years ago, they came in and asked for some extra money for
Hang on, give me
clearing
a
some
second.
trees, but other than that, they didn't really do much.
So I think back then they actually had a surplus in their fund and now I pretty much just allocate levy enough to fund their budget instead of building a fund balance.
So I had to add my name to her account.
What were the two things they wanted? You said 33,500. What was the other one?
$33,500 and $100 in office supplies.
Okay.
That's required to go out in public, like that would be required to go out to the public. I didn't process them, yeah, so this is still. No, there's it,
Or her replacement.
correct.
Yeah, it goes to the clerk and then the clerk files it. And then I have to appoint whoever is replaced just because there is no, precinct leader there. So it doesn't go through the precinct leaders, it goes through actually the chairman.
Why, I'm just saying.
Oh,
I haven't seen it in the
Kathy,
movie.
it's Kathy right out of the city. She was an accountant. She's previously held those positions. At different townships. She moved away because she had for 6 years a mother. Yeah, that had cancer. When she passed away, she just came back into the community. And that's why we haven't seen her in the township trustee yet.
Advisory board.
If I was in that township.
A couple more to
I haven't seen it yet in the media.
First, at the first Tuesday.
I mean,
We'll shoot for
there
it.
has to be notice.
Yeah.
Yes, I'll send.
Thank you,
That's
sir.
what I was, and she's been moved, she's been gone for months,
Mhm.
that's why I was just curious, I didn't know that,
She would do that.
with the media.
I haven't, I mean, I didn't announce it through the paper. We don't have to because it's a township. Because townships don't have to. They have to have public meetings and all that, but they don't have to announce role changes.
Elected position is not required to be
Mm-mm,
announced in the media,
mm-mm.
dang.
Just as long as it's put on the with the clerk, registered with the clerk. Yeah. Mhm. Since it's just yeah, and we didn't have to have a public meeting, those positions can be appointed. Yeah, but they don't have to be announced.
You guys ready?
Kind of like precinct leaders,
You guys are, Mr. True?
similar to precinct
Mr.
leaders.
True, yeah. Thanks.
I was surprised too.
Give honor to who honors due, right? For sure. Morning.
That's-
Good morning, everyone.
Huh?
Where's his budget?
Oh,
Thank you, there's a, and general and all of it's right.
it's what?
It says county general. Heather?
County general is 360.
360.
Okay.
You can go ahead.
Yeah, go ahead, I'm sorry.
Okay, no, sorry, I still want to feel our stuff done. So, really the only increases that we're asking for, a little bit more fuel, a little more travel, and a little more vehicle maintenance. And, so I think that goals to be, right about $1,400. So, I mean, fuel costs obviously have gone up. We're doing a lot more travel because, we've become Tornado Alley all of a sudden. And, so that's cost us a little bit more. And, travel's costing more obviously because of fuel costs. And on top of that, our training, those courses that we have left to do now and to keep adding to, those are becoming those 3, 4, and 5 day courses. So, so for us to make sure that we're staying up with the current training that we need to be at, then, it just costs us more money to get there back and forth. We've been lucky, I'm gonna say lucky and fortunate because I try to get into these things early. And usually the state has, you know, some rooms available, things like that. They offer some supplements for that. But that, seems to have gone away now. So again, costs are gonna increase when we travel and a bit for hotel rooms and stays. And, all those things go along with that for, you know, 2, 3, 4 day hours. Most of those things, they come along maybe once, maybe twice a year. So if we don't get in, then we don't get in, and if we put it off too long, then we'll risk it like having to kind of start over again with some certification levels. So,
Are those considered state called,
sorry,
are those considered state called meetings? Or-
it's not, it's just training stuff. They're not state called
They're not
meetings,
state
but
called,
yeah,
okay.
it's just through the CADA system, and they offer different things every year. So, those bigger section head leadership roles for major incidents have become those 3, 4, 5 day courses, and I think they've only offered the finance officer course that once this entire year. So, a couple of courses that they had offered, and they have enough people put in for those, and they ended up canceling those. It's a fine line about who can make it to where and want to bid, whether they have it. I think there's some courses that we certainly need here, because we have some little gaps that we'd like to fill and get a little bit better and a little more information for when something happens, and when something happens big, how we're gonna fit into that system, or how the system's gonna come and fit in here. So, obviously we want to do our due diligence and make sure that we're ready for when that goes down. So, any questions from you guys? I try not to be very needy. We try to cover most things that we need operationally with grant money. And we've been very successful with that, I think, over the last handful of years. I'm happy about that, but the next couple of years, I think we're gonna start seeing some kind of hits from the state. So, and maybe not so much this year, obviously, because we're just asking for a little bit more money, a little bit more vehicle maintenance. And to add to that vehicle maintenance, the list there is, just a set of tires for that truck is $1,800. So
There goes your 13.
yeah, there goes there goes the money for the vehicle maintenance fund there for sure. So again, we pulled some money out of some grant stuff that we have all out there just to make sure we're covered, but and stay operational and successful. But just a heads up on that.
Remind me, the public information line item, which is 1,000, that was spent last year, there's nothing been spent so far, or at mid-year when these reports were pulled. That's not information communication with that's not cost for the rave system. So what would you expense out for a public information line item?
So it's public information that we pass out to people. We have a bit of a surplus of that, so that's all we're not spent in yet this year. So we usually take things to basketball games or things like that to pass out to people so that they stay ready. We've done several community events this year. and gotten.
Written education.
So yes, yeah, just pamphlets and things like, hey, this is how you get ready for floods, this is how you get ready for tornadoes, this is how you take care of things, and these are the dangers of why to pay attention to things at nighttime versus daytime. And here are the steps that are necessary for you to prepare for, and let's do that today while it's the sunshiny day. Blue sky days rather than at midnight when the alarm goes off and you're panicking thinking, oh my God, what are we gonna do? So yeah, I think we've been pretty successful with that. I think the RAID program has been fantastic. We have a great relationship with National Weather Service. We partner with them to get notifications out, so it'll top of the list. So I appreciate that relationship and how we're able to interact, and it's due because we've done so much work and things with them, so.
Those
I
alerts
think,
are loud.
sorry,
Those alerts are loud.
they are. If there's anything that left takes you off the bed, man,
Yeah,
good luck.
it is.
I think I'm ready for that. It is loud.
And I still wonder, I have to wonder too, if, just random, maybe something each quarter, reminders, I don't know, you know, the radio one quarter, Madison Career the next, big social media post the next quarter. But I just had somebody last week, went through all their stinking life and they didn't know about the text alerts. You know, I'm thinking, how do you not know? But that's valid. There are folks still
Sure.
that don't. And typically the complaints that, you know, I don't live in the city, so I don't hear a tornado siren. No, but you can hear your phone going off and I guarantee you,
Yes.
you most likely have a cell
Our
phone.
neighbors don't know.
Yeah, so which is great. But again, the value of you sign up for, you know, road alerts, trash alerts if you're utilizing the county trash service. So yeah, I just wonder, and not that that would be all your responsibility, but I wonder if even some scheduled and frequent reminders for folks, we just assume everybody signed up for the
Yeah,
rate
I
and not
honestly
everybody
think
is.
the number is pretty low. So like the board out here, we put that information on five things
Yeah.
there. We try to put social media posts out on our business. I'm not much of a social media guy. I think it's, you know, it's a great thing and a horrible thing all at the same time. And, you know, and honestly, we've been busy enough with trying to just survive from disaster to disaster to make sure
We included the EMA stuff on our trash card handout that we were handing out so that they could see that, and also the tax. That they could also do taxes as well and get tax updates.
Good.
So we have attempted, but I think sometimes people get annoyed by the text and they end up opting out, and then they wish they had not.
Yeah.
Sure. Sometimes the weather alerts go out a little bit odd. That comes from the National Center. So the National Weather Service is separate from just weather alerts. They do the weather predictions and they send that out to the local media people, and we're on that list when that comes out. So that comes out pretty early in the morning. So a lot of people don't want to get woke up at 4 o'clock in the morning to check those weather alerts in our business to see what's coming for the day. And I mean, I understand that. I do, you know, work shift work or something like that. It's tough and nobody likes to do it like that hard early. But if you are not signed up, there is the iFall system. So if there is a tornado that's imminent to a location, then we can put a polygon around that area specifically and target any cell phone that happens to be on, that's gonna get that alert whether they're signed up for it or not, so. And that's where, you know, the weather service comes in really good for us, so we work hand in hand with them on that notification thing,
We
so,
received one whenever it went through deputy. That was my first
yeah.
instance of that.
Yeah, I think the system is well thought out, and I think there's some kind of chunky things with the system, just as far as programming wise. But I think it's worked pretty well when it's needed to, and we can put that notification out for fill in the blank emergency.
And we didn't have other county, I was just thinking the health department was forage fair every night with other, you know, from immunizations. I mean,
Sure.
even in their position, they could have promoted to the community why you want to sign up for regular alerts. Here's.
Yeah, I've been to the fair, you know, and I know I spent some time with you right there at the fair, all that business, and it just seemed like, you know, people would swing by and you know, get his head down and walk around and all stuff or stop talking a lot bit, so.
Yeah, they wanna see what you got for free.
They also
Yeah.
talk to, per yard state to get moving.
Like,
Maybe that's, or they give them, pass out rain gauges or something, I don't know. I've tried to give away those thermometers, instead of a bunch of those out at the warehouse.
Well, that saves lives, so I mean, when these storms that came through this year, the most violent of them were when people were asleep, man, that
Yeah.
just bring the death toll up.
Yeah, it's
In the morning.
yeah, it's scary.
multiple.
We're gonna have some scary weather.
I see,
It shifted
yeah.
down, so.
Yeah, I'd button down houses at lunchtime if you got some chance to get home.
But still, that makes it different.
Yeah.
When you're working or you're awake, it's like a fire.
Sure.
You know, there's a big difference between a fire happening in your house when it's lunchtime or, prime time, 6, 7, 8. Man, when you're asleep, that alarm, to Ray's point, that can save your life.
Yeah, and that's why it's allowed. It says,
It works.
There's even vibration bed alerts that would go for like your weather radio. There's a vibration pad you can stick on your mattress to shake it a little bit maybe. Some people may not, I've heard them sleep, so they ain't waking up about nothing.
Yeah, that's my son.
Yeah,
Yeah, my son has one of those alarm clocks.
and my dad.
that has the-
Yeah.
Yeah.
Yeah. It passed right over top and it was timely. It was
Yeah.
loud, it was timely, it was different.
Yep.
And I wasn't upset. I was like, what the heck is this? And then, yeah, so,
Yes.
yeah, it was good.
Help me out on buildings and grants. Would you be flexible to move in a little bit more than that into vehicle maintenance, or are you?
Yeah, well, I mean, we're paying for grass to get cut. It's really contract service to come and do those things. So grass and snow removal are the two big ones for us. And depending on how much snow we've had, then and typically we go through that fairly quickly. Little things that we need to tidy up if we need the HVACs looked at or whatever, a lot of it, that's where that comes from. So, I mean, that's pretty tight.
Okay.
I mean, our budget overall is pretty tight. It's pretty small compared to the things that we're doing. And so, I mean, we might have just a very slim margin of wiggle room in my mind, but
Maybe some.
maybe some. So for future wise, and I've not really come in to ask a whole lot from you. Word from FEMA and word from the state is that, all those secondary and second and third and fourth, rounds of damage assessments, there's gonna be less and less support from FEMA and from the state, in the future. Matter of fact, I think the new director for Homeland Security, I think is even mentioned that he'd like to do it with that, he's like already.
Did he would like to do away with that?
With them supporting that portion of that funding to come down, so I think there's a chance for that. It's looking like it's probably gonna. So we've not got official word yet, but that seems to be like the big looming thing that's out there, so, future wise, 27, 28, I think we probably need to start looking at some staff. For those reasons, and I'll give you a great example, is we're still duking it out with FEMA over, what was supposed to be $1.7 million worth of job, related, allocations for county highway roads. They've whittled that down to about $16,000, and now we're arguing over 20 foot of repair work for mitigation.
Is that from the flood?
Mhm. From 2005,
Right.
so. It's, I don't know, I've talked to some people from different states, I've talked to some people from, inside the state, it just seems like, for whatever reason, even, a lot of our people, just seem like, I don't know, the region that we're in kind of. Indiana gets hit a little bit harder than what some other places get, and, money wise, we're.
Probably due to funding, doing
Seem
all out Asheville and all over there, the requirement and there wasn't much money left.
yeah, I don't know where you actually even sits, because the damage down there was just absolutely unbelievable. I mean, I know Texas got a pretty quick check, California got a pretty quick check. But I think they're still trying to recover there. It's insane.
Mhm.
And to see that pictures is one thing, but to stand there in this massive canyon that's gotten washed out even more.
So that may be their focus, of pull.
Well, there are different
pull
regional
drawing,
DRs
yeah.
and things, so, yeah, so I don't know how that's split and if they're drawing from one or the other, I don't know,
Mhm.
politics and.
Yeah, well-
And some, but
Did you say it was Chicago? Where'd you say that?
our office.
So we gotta communicate way up north, don't we? So it seems like the further south you go, maybe.
Yeah,
we
yeah,
get-
well, we're on the line, so the split is Indiana, Kentucky, so Kentucky is in the Nashville or the Georgia region, sorry. And that's completely different.
We're definitely on the fringe, aren't we?
We are, and we've also sent some information to them, because one of them offered to do a case study on this flood.
And, I mean, we were arguing about moss and cracks, and I sent them a study from the University of Iowa where moss grows in 6 days in southeast Indiana. And they just kept asking for things, and I understand they can't just come in and write a check for everybody, I get it. But end of the day, it's like we had $1.7 million worth of projects that were supposed to be allocated. Their engineer people came, we looked at all that stuff. And I thought we had all agreed and had a good plan going into that, and now we're down to $16,000 and arguing over 20 feet. So where it goes and where it gets out of people's hands and why they decide what they decide, I don't know, but I agree. I mean, there's lots of places that have been hit harder than we are, but end of the day, I mean, we're all honest together to win it, and we're not sending subversive information to them and overestimated,
Right.
repairs costs. So I don't know. I think that's gonna be a big one in the future. We'll probably hear more about that in the next, handful of months. I think our radio system has, some big gaps, where we need to get some of those filled. And just so you know, there is no date on this phase 2 radio switchover. So I know there's been a little bit of talk about that, kind of kicked around a little. It's in process whenever they find the money. I think it's that will be a system upgrade. When they do, there'll be a lot of radios that are gonna be able to come off of that system. And just to replace the current radios that we have is gonna cost us about $800,000. And those are just the handheld radios that they keep on their belt to walk around. So this may be in the car or the console stuff that Brandon works off of and all that stuff. Just portable radios, and that's it. $800,000.
You gotta buy good ones or you're wasting your money, aren't you?
Well, it's, you've heard the old story, buy once, cry once. I remember when I was a kid, we had, horrible tennis shoes, pay $10 for it last month, and next month you get $10 in tennis shoes. And in the end, you spend as much money. And so the state system is Motorola. 80% of the state uses Motorola, and all the interfaces. I've not seen systems integration work super well. If something is built on this platform and we try to integrate other things to that, I have not seen where some systems engineer person has fixed that and it works flawlessly like this.
So Kenwood's not gonna match up with Motorola.
Well,
Plus you're saving just a little money, they're expensive too.
Yeah,
We've talked about this a lot.
we
as
have,
far as
and I think
radios.
the extra warranty things that we can get from them, I think we'll end up paying.
How about Motorola?
Yeah.
That seems to be the standard. It really does.
Well,
They're
80%.
expensive, they are
I
expensive.
know they are, but they're good though, aren't they?
Well, but like I said, they're expensive. At this point, Kenwood's pretty okay. It's integrating and it's working, and we can afford it. When you start talking volunteer fire companies that aren't financed, we've got the issue. What's more than adequate and good enough for the need at this point. So, and like you said, it seems like every couple of years, we're spending $7,000 a handheld radio for, the fireground officers for dual band. And so there's a bit of a conundrum. It's not just, it's almost like they got a monopoly on it, which we wish wasn't the case. A little competition would probably be nice.
Sure. Yeah, I think they feel a little bit, and Kenwood radios are expensive too. I mean, you probably could knock off maybe not quite $100,000 to replace all those. I mean, it's still gonna cost us,
It's still
$3
pricey.
million.
Yeah.
Right. So
I'll tell you, I
I've
really
heard
feel
a
later
lot.
that that's.
yeah. And if you don't know, we share this radio system with 11 different agencies. And on one of the towers, we have 5 people can talk. And the other tower we have is 4 people can talk. So not everybody gets to talk on the radio, not everybody gets to hear each other all the time like in the trunk system. So that's a bit of a gap. When the tornado came through last 2004. I was on the way back from Belterra. I was at the conference there, and I saw a tornado in Kentucky. Was trying to notify them to call Kentucky, said, hey, they get some where tornadoes coming through at, and I couldn't get through. You get the missy signals on the radio system. So
I remember when I first got on the advisory board in 23, I asked Troy, I said, what do you need? He said, we need radios. And so that's going back. And I think they were $5,000 or $6,000 then.
right.
And that's been 3 years ago. It's just,
They've gone up.
Yeah, that game is changing. I'm hoping that at some point this satellite thing might, kind of come into play. And, maybe be able to reduce that a little bit.
well, thanks for giving us a heads up on that. We know that's something we gotta have to
Absolutely.
address.
And I would say this is really kind of for everybody system-wide, countywide. Cybersecurity is becoming a bigger and bigger and bigger
Yeah,
issue.
sure.
And I'm telling you, this keeps me up at night because I can see a tornado. I've been to those. I've been to fire. I've been to lots of natural disasters and seen a lot of things. You don't know this is coming. You don't have a clue until it's too late. And the way that we are, so we had an inspection done by IoT and the Office of Technology and CISA, and we have great assessments from them about the current system that we have. And the things the state offers for free, we're plugged into that system, and that seems to be working okay. There are a lot of things that we're behind the 8 ball on with this zero trust system and then getting our system segmented. So we have everything in one big bucket right now on that courthouse server. And if that gets hacked, everybody gets hacked. If we segment, then if one bucket gets hacked, then that doesn't necessarily mean that everything else is gonna fall in line. But in the position that we're in, I think that's probably the next biggest ticket item on the list. Besides some radio and staff. And I would say the radio system and cybersecurity are one of these, they're probably neck and neck about the importance level about making sure that we're taking care of people and taking care of our stuff. You probably have seen, there was seven states were affected by hacks of the water departments. Man, you talk about taking care of, really causing some havoc on people. I mean, when I don't know how many counties were affected, but that many people over potable water, that's a huge issue.
That just happened in Michigan, didn't it?
It did. It's happened all at least 7 different states. And our systems honestly it's pretty scary. We had a physical assessment done by CISA that came down and did some assessments on the water systems for the city. And they're gonna come back and we're gonna do those later this fall, for the county, water systems. And just see where they are security wise a lot bit, but it's frightening and scary.
Well, I went to,
And we should be scared of that.
yes, the AIC meeting one I went to last year or year before that, they had one on cybersecurity. And the guy that was the instructor on that, he said that they're here, we're at cyber war now. They're here now.
Yes.
There's a war going on right now. It's not something to prep for. They're here, they're getting in. And so we're going, and there's something like for every one of our people that were pushing back, people that were, digital warriors, China has 50 or something like that. So those aren't good. Those aren't good.
Yeah, it's scary and I think as emergency managers, I think for a long time, we just didn't understand that well. And we're starting to get more better information and on that and see how that relates, how this is gonna just basically devastate the county if need be. I mean, somebody got in not long ago, I forget what state it was, now they told us to make this meeting the other day. Some state, it was their HVAC group that came in and made some switches and like the thermostats that we have, you can like remote check into those things and log into those things. And that was a vulnerability. That's how somebody got in. Somebody got in on a refrigerator that talks back and forth to the internet. And then that's how they're backing into the system and they're there. So,
Wow.
yeah, it's scary and
Somebody did that at Southwestern Schools last year.
they did, yeah, the hospital got hit huge. I mean, how long Heather did that go on? That was, yeah.
And then 18 months after KDH did Norton as a whole.
Norton property, yes. And it was interesting to see that, and it was horrible what happened, but when one of the classes we took, they talked about that, like there's a small little offset to the system, and they'll figure out how to get into that. And then they'll go and hit, I'm just gonna say the mothership for lack of better terms. And sure enough, they spent enough time in KDH system and hit Norton's proper and I can't even believe how many millions of dollars that they would have spent on replacing all the hardware and all that. I think it was almost $2 million to replace it all here.
But they only gotta get through one time. We've got to defend them every time. They've only gotta get through once. That's unbelievable.
Any questions, anything I can answer for anybody?
How are your stocks for preparation? Yeah.
I'm good. We've got, I think we've got 8 cases of there's 72 meals or 72-hour meal pack out there. Eight skid loads of those. We've
So
got
we're
4
getting-
skids of water all out there. So,
And we're getting,
yeah, it's pretty well full out there. We got some more room to put some things. And so we're looking to get some more costs and stuff like that on there, but I think we're in pretty good shape. And I'll base that on relationship. We spend a lot of time talking and doing and all that business, and I'm a relationship person. I think it's easier if you don't have relationship points with someone to say no. So I want to be friends with people who have stuff. And
That's right.
and it's worked out well for us. I won't say that that's not any different for anybody else. I don't know. But I know we've been very fortunate to get things we get, and we get a call pretty quick when there's some surplus anything. We make that trip pretty fast to go get it. So I've got 2 skids of clipboards if anybody needs anything. Troy and his clipboards, man. So.
You can go there for $5 a piece. You will probably be okay with your staff, wouldn't you?
Yeah, no doubt. No doubt. Yeah, we got a bunch
For
of
a couple of years.
routers and clipboards, giveaways.
That's
That's
true.
right.
That's true. All right, nothing else? Thank you.
Thank you.
Appreciate your time.
Appreciate it. We're just got a few minutes. Should come on in.
It's an important thing,
Oh my gosh, it's a bottle.
Animal shelter will be under all other 4008.
There it is. All right.
And I think,
All other 4008.
I don't know, I might have included fund balance.
So sure. Yeah, I didn't bring fund balance.
I feel like, I feel like at the very end of my process, I got a little rough, but there for a while, I was doing all the extra information. Oh, yeah, I even included building donation fund, but. Okay.
You're a little bit lower.
Yeah,
We'd love to see that.
I'm trying to, but I also don't wanna go too low that, that we hurt ourselves.
Have to come back in.
Yeah, and have to come again and ask. But I tell you, this year though, has been, I don't want to jinx myself, but it's been really nice to have a full funded budget. It's been nice.
So per interlocal right now, the city is to pay 60,000, the town of Hanover is to pay 10,000. And the town of Hanover, cause it says up to 10,000, the way that was written. They decided not to fund it 100%.
They paid what they paid years before.
Yeah, so supposedly they are fixing that in their budget request this year, but if you guys have any ties with anyone in Hanover, I would maybe reach out to them and be sure that they have actually budgeted for the full 10,000.
Okay, so it's a semantic thing. It said up to 10,000, so they
Yeah,
Yeah, and
can
I,
give 10,000.
so I requested our attorney to change that language because I think it is. I think we should know exactly how much we are getting every year, but there's a little bit. He's also their attorney, so I don't know how that
yeah.
works. So there's that.
Who pays him more?
I thought Devin Sharp was running here, was
No,
Their attorney. Or he's on their board.
he's not?
Pat is their attorney.
Okay.
Pat is their attorney and our attorney.
Devin's a board member.
Yeah. Yeah, Devin's on the board.
That's it.
So I requested that we change that. I don't know where we stand. We're supposed to have a quarterly meeting every quarter to update on legal things that we're working on together. I haven't had one yet, so my second quarter.
I noticed on your volunteers this year, you're asking, what was the 250 for?
I think for appreciation.
Right,
and
so-
some stuff like that, but I, like throwing a pizza or giving them a pizza party or something like that. I can do that out of my own pocket. Well, I'm just saying that I
Okay.
could, but we don't have that. Like, when I left in 2018, there was 6 or 7 just solid members that were there at least 2 or 3 times a week. You know, and they did things for us and it was great. And they did a lot of things. But then when I come back, it was like the volunteer was, they'd come once, maybe every 3 months, you know, or it just, there isn't that solid base where a dependable volunteer. And I don't know if the, you know, the economy shifted since COVID about volunteering. I get the college kids, but all they want to do is just come like walk the dogs, you know what I mean? It's not like in there,
Cleaning up.
right? But then again, in 2018, there was only 3 of us on staff, and now we have a 6-member staff, so the cleanup is done more by the paid versus back then, so a lot of things have changed up since then and now, but I have not spent any of that $250 since I've come back,
Okay.
so I don't see the need for that line item.
Okay.
If you ever are in a position, I am a fan of volunteer recognition and sometimes just a thank you card can go
Yep.
a long way,
Right.
but if you are needing some, you know, small little
Well, see, we
volunteer
used to do-
appreciation, you know, thank you for coming type, you know, you can let us know.
We would have them like a Thanksgiving meal, you know, and some of that volunteer was also for the DOC girls. You know, we would spend some of that money on snacks for them and stuff like that to thank them for coming and helping us clean. But see, we don't have that either anymore, so.
You don't have that relationship with them, is that even, I think that's such a blessing for.
Yeah, but it was because the prison went to a higher level.
That's right. Security.
Yeah, and a higher level of security, so the ones that can come out on work release.
Yeah.
Are thin now. And the
Right.
city and everybody else gets them, I'm last on that list to come. You know, maybe some year they'll have enough that are down low enough that they can come out on work release and we'll get them back, but. Right now, that's just they're doing their best to supply like the city crew and the mowing crew.
Right.
I see where you made an adjustment on cleaning supplies.
Yeah, yeah,
That's,
um,
and one other thing about cat and dog food, which is very important.
it is.
But how much donation do you get in the cat and dog food? And how much can you depend on from, it's. If you can give me a.
Yeah, it's hard to know each time, but I've been watching what I actually spend from the fund versus what I get from Walmart, what I get from Tractor Supply, and now we've got the new Augars, yeah. And, so there's all these other and then Five Below, they've actually been like donating all their stuffed animals and stuff like that to us, and, you know, every time they turn something over that they think the animals could enjoy, they're giving us gifts galore, so. I don't know if I could put a dollar mark on it, but I feel confident that what I've lowered that to, that I won't, and if I do, we do have that, the supply,
Of course.
general supplies donation line item
Yeah.
that I think I could pull if I needed more than that from that. Okay.
Because how are you doing with Walmart? I know we talked about how's that relationship going? I know you were having trouble with communication there.
Yeah, they still have not, there's like this big long, they changed up their procedures, right?
Right.
So if you were in it before, you were grandfathered in. Now any new nonprofit that comes in asking for supplies or donations or anything like that, they have to be, what is it, Deems, I think is what it's called, Deems certified. And to get Deemed certified, you have to have a PayPal account for 6 months or longer and have a certain rating with the PayPal.
Okay.
Or deeds, that's what it is. The Friends group, because the shelter, because we're government, does not fall under their charitable things.
Okay.
So I had to start the Friends group and we got the Friends in there and we're now deed certified with Friends, but they're not finding our number. I can pull it up on my computer and show them, here's our number, here's our stuff, but when they type it into their system, they cannot find Friends.
We talked, that's been going on all year.
It's been
We've
forever.
had issues with tax exempt with their new system as well.
So I mean, it's been a long time.
Okay.
But they still have us a cart where they're putting stuff, but it's not as much stuff
Right.
because it's not like. So it's coming through the Salvation Army now.
Okay.
So they leave it there, Salvation Army picks it up under their number and brings it to me. But when the employees at Walmart, you know, see a spilled bag, they're not like thinking, oh, well, Salvation Army will want this. You know,
Right.
if we had the Friends of the Shelter or the shelter, you know, I think more items would wind up on our cart that were damaged. But I have not had them for so long that I'm still surviving without them, so. I don't know. I really don't know what else to do with Walmart. At this point, I've just kind of stopped trying, really.
Okay.
Cause I've jumped through all their hoops and, I mean, formed Friends. That was the whole reason I formed the Friends group, was just to get the Walmart donations coming back. And it still isn't working, so I don't know what else to do.
I advised the employee to go somewhere else and buy what they were wanting since they wouldn't accept our tax exempt.
Yeah.
Go somewhere else.
They were saying, because the shelters of government, we can't be part of the program anymore. It has to be, you know, totally nonprofit organization or something, so.
Well, the Friends has been good for more than one.
Yes,
reason.
it
It's ended up being a
exploded
blessing.
into something
Right.
completely different, but yeah.
Does anybody have anything else for Tricia?
No.
Keep doing your good work.
Yeah.
Trying.
Thanks for,
And then I'd just take a moment to give y'all kind of an update.
Mhm.
IEDC gave us our pre-approval letter, so the shelter building is, you know, completed that next step. I met with the architect yesterday and we're finishing up the final. We had to make a few things a little bit bigger, to help IB Tech, because their classes for this vet nursing has exploded, and instead of,
Oh, yes.
they were thinking they were only gonna have 18, well, now they're being accredited for up to 24 students in it. So we needed a
It's
little
just
bit
not
bigger.
here locally. I have a client in Connersville that drives down
Yeah,
all the way. That's a long drive.
Kokomo, I
Yes.
think is the Kokomo, Indiana, or something like that. There's a student that comes from there, and that's the farthest.
So it's very impressive
Yes,
and successful.
and she's got 50 applicants for the next semester already, and she has to narrow it down to 18 right now, so.
I bet our regional vets are going, yes, we need the help. That's just
Yeah.
tremendous.
Well, everywhere, I think,
Right.
are getting appreciative of this, cause. You know, that's their vet's right hand man, that's.
They can do so much for the vet,
Mhm.
you know, for the doctor.
Yeah.
They don't have to do, what a
Yeah.
help, and it's a good occupation. I mean, there's a big difference between going to school for what, 2 years and going to school for 8 years.
Yeah.
So. Yeah, that's great.
But I mean, was there anything in there that I asked that y'all see, like having anything up on? All right. I am hoping to bring in some more training. They've got what we do down, but I think further education for the staff.
And I'm gonna assume in your line of work, virtual education, which is fabulous, but I'm gonna assume that's, not ideal and or not offered much.
Yeah.
Um,
Yeah, well, there's a lot of online classes that
are there?
we can take. It's just the time for everybody to sit down and like go through them while we're at work. Versus where like the dog days out of Columbus, having one of them come in and train us all, you know, simultaneously, I think is will be great on them. I just want, if y'all have never, Dog World, if y'all have never looked at their videos.
What is it again?
Dog World.
Okay.
Out of Columbus. You walk into their shelter in the video and everybody is nobody barks and it's all hand commands and stuff like that, but it's so peaceful and they'll sit just, I'm like, bring that to my shelter. And he says he can. He says he can teach me, you know, the new ones coming in will be disruptive until we teach them. And he's been teaching with the prison, training them girls, and the prison says that it's been a miraculous night and day since they come in, started training with them, so.
And it's a win-win for the prison too, for those folks to be able to interact. I mean, it's helpful to them. Yeah, it's great.
All right.
Thank
you.
Thank you. All over.
Thank you.
Thanks, Tricia.
Yeah, thanks.
I just wanted to touch on, she's actually been able to grow her fund balance. And that is a local, fund. So. And it's above and beyond what her request is, so, I hope that we could even use that towards some of the building as. So as we look forward through that, I think we'll have an opportunity to use.
We did that last year, didn't we? We did something last year.
Well, I knew it was a possibility, I would really love to be able, and I need to reach out to State Board of Accounts to see if there's a way that I can actually move a portion of that money at the end of the year to, the actual building fund.
Building fund. Mhm.
And if that, then of course I would bring that as a transfer, like a one-time fund-to-fund transfer. And since it's local funds, I think we could probably do that, but I just want to be sure.
Sure.
Is
Good
there,
idea.
not the, so the three separate funds, the,
Mhm.
not the not the 4101 building donation fund. The 4101 is animal shelter donations and 4008 is just animal shelter.
Right.
Separate from a county budget. So is there a reason why like the 4008 and the 4103 shouldn't or couldn't just be combined into one? Or when those were.
I think originally when, that was set up, originally it was all ran through one. And then when someone wanted to donate specifically for the building, then we established that separate
Sure.
fund. And then, it was advised that we have that separate, all donations should technically go through a donation fund.
Yeah, and I guess I understand the restricted and non-restricted, the building donation thing separate, but the other two are donation funds.
Right, so I think there was a sizable donation that requested a separate fund. Initially, that started that. And.
But not necessarily to your knowledge, a specific purpose, like this one doesn't need to be labeled as spay and neutering fund or.
No, so
From that.
on 4103, people make donations specific to spay and neuter, etc. And then she keeps track of that. And then as she needs to do a spay and neuter, then she'll request to have that money appropriated. So she kind of maintains her separate, how
Yeah.
much was for general supplies, how much, because they have 3 different options, I think, for that fund
Okay,
that they can donate.
yeah. Yeah, I didn't know if there was a restricted purpose for the 4008. But
4008 is typically just money earned from adoptions and the interlocal agreement.
okay,
That's the only thing right through that.
gotcha.
So if she said if she ever had to pull from her general, this is what she's referring to, right? The donation fund.
Well, the 4008
Yeah.
is what she
That's what
refers
I
to as her.
Sorry,
Yeah,
I should
that's
For
right.
general
have replaced
operating
that
fund.
number even.
Bulb is getting brighter above my head.
I'm trying to screw it in the rest of the way.
Cause we got busted on that in 3 different directions.
Won't take much voltage to. Smoking.
It'll burn out before it ends down.
Who would have thought council could be fun?
Right.
I will put your, put about someone from Hanover's there.
Yeah, no, it was news to me when I sent the invoice, a copy of the interlocal that was signed. And I got back a reply.
Yeah, I know. And that's where I think that we were all like, should we know?
The reply is zero is up to,
Gotta have some skin in the game.
up to 10.
Yeah.
Zero
This guy.
within
Right.
range.
Do that.
Well, and that could be catastrophic if everyone decided to just be like, well, here's $500, that's all I could afford this year.
Yeah. Is Lindsay here?
That's true. I think I saw out there.
And you're not feeling easy.
Mhm. Yes.
I agree.
Yeah. There's a order.
There's a lot of new numbers.
No Lindsay as of yet.
Okay. You know, she's trying, wanting to add a new clerical position. Cause I just noticed that 30,000 in there.
So, okay, so the clerical position was moved from 1159 last year to 1161 to help alleviate the stress on 1159. That being said, now she's getting at the point where she's really crutched on that 1161 hard for the last couple of years, and it's getting to the point where she's gonna have to start pulling back.
So she's just
So-
moving it back.
So she either, and then she just, I think she's gonna have something written up for you guys, a couple different options, how to proceed.
So is that the same with the janitorial and environmental supplies and?
Right, yeah, she had a couple things, that she stopped in, Thursday, and we discussed, and I said, and even some corrections to this year, that we were paying some stuff from 1161, and that she had kind of planned to pay from 1159, but maybe an error, it was left in 1161. And she didn't really know, because 1159 is looking so much better, if she should move all of those, or if we should wait to the end of the year and kind of play it by ear.
Like we're doing now.
And that's kind of what I told her. I said, everything's so touch and go right now. Maybe we should wait. Don't jump into making, because it was like our payroll system was already set up to take some of the FICA and stuff like that out of 1161, and it didn't get changed. I said, I think I would just wait and see if how it changes. We could always move a portion of it over and move those. So,
Yeah.
but she has some options.
And the Hanover, I was gonna tell you, the Hanover Township money,
Not in.
their capital campaign was for the fire department out there. Cause I received a message,
Okay,
no,
okay, if he heard it.
so that they're definitely, so it's pretty much the same across the board, I would say. capital campaign, because we were talking about Madison Township, how they had their capital campaign and their surplus.
Right.
And most of these outer line townships do not have a surplus because they're, when they were required to create those, they didn't have a lot of funds, and what funds that they did have, most of them went to the fire department.
That's right. So you're talking about something.
Yeah. So I've had some people chime in, well, when they were seeing that.
We're going, oh, really?
Uh-huh.
Well, we're going to,
Right. Was the priority.
Yeah.
That's interesting.
but we want to take care of that
For a little
too.
bit, yeah. Jason asked me if it would be okay if John came to get started. And then Jason would be coming in, and I said, yes, and honestly, if commissioners are here early, we can go ahead and let Dave start in on the tourism and explain that, and then maybe it'll give you just enough time to.
It's rebalance.
Certain back time just a little bit as per.
Mhm.
And so I mean, there was something.
Mhm.
Who's in the governor's?
Yeah, they can see, yeah, what's the point of that? She knows that.
Hey, Ron's nuts.
How are you, Lindsay?
Yeah. Yeah, yes.
Good. Thank you. Your parents pulling out their house.
Yeah,
I know.
that's on the message last night.
They're doing that this morning. They're like getting everything out of the river.
I heard it's getting ready to flood.
Yeah, 12 feet. There'll be no beach down at Hanover.
Is all approved.
And so we have money betting on whether Todd will pull his dock or just let it. Against the rock wall. And I was like, we were gonna go down last night and pull, but we didn't.
That's what they were talking about, that I should have done it last night when I was with you.
Mm-hmm. He has a nice anchor cord, or
Yeah.
you know what I'm talking
Yeah.
about, the tie off.
Mhm. But
His is
It's
farther up,
still-
see, ours is like in the middle of the beach.
it still just beats the heck out of it, like.
Oh, I know.
the
I know.
rock and cause those anchor
Oh,
ties are
Yeah.
still really long.
I bet it's busy
So
down
it-
there this morning.
I mean, the dock can,
Oh, I know.
it'll be
Okay.
way up.
Yep. Yeah,
Yeah.
it should be at there's, you guys down on that end may have more beach than what I don't know.
We have a little bit more
Mm-hmm.
of a
But
beach,
it'll be
but
right up to the
it'll
wall.
still be a,
That's really like, looking.
Okay, as long as we don't get to about 50 feet.
It's 50 feet, we're all in trouble.
Alright. I go by Mark one.
Yeah, oh, okay, got it.
Are we ready? For the health department?
Yeah, right.
All right, go ahead, man.
so I'll probably just start with what I handed out because I think it's has a little bit more, would answer more questions than you would have or anything else. Because most of the budget that I submitted is a direct carryover from what we decided to do this year. So most of those lines are the exact same dollar value. So when it comes to the payroll and salary, I gave you the same sheet that you guys asked for last
Year, yeah.
So it has what they're making currently, and then if you go over to the right, you'll see columns. So there's the county, the tax levy fund is the first one. HFI, the Health First Indiana Fund is the second. The third is the COAG grant. That's a grant that we received. I'd say like, I think Anne actually received it. So I think it was 5 years ago when we got that one. That was a COVID funded thing. So what you see in this column is actually the last of the money. It's more of a projection at 33,000. If you go down to, I numbered the employees, so hopefully that makes it easier to follow. So employee number 10. If you go all the way down, that's a projected number, and it's not reflected in the budget request. So that'll get changed. But I think that'll be our last few pennies out of that. So that fund will go away. The next one is the emergency preparedness. We only have one employee that gets paid out of there, employee number 6, and it's our emergency preparedness grant. It goes towards our public health coordinator. So it's historically been $25,000. Last year, this year for the 2026, it was actually only 20,000, but they're bumping it back up in 2027. So we get that $5,000 back. And then the last column is a grant from Bethany Legacy Foundation, and that's what pays for our behavioral health navigator, which is employee 14 on this list. And you'll see some asterisks next to the numbers, and those are explained at the bottom. So last year we moved our deputy registrar, which has always been paid out of 1159 to 1161. It's just something to keep in mind and remember that we moved that over because we were having some funding issues in our tax levy. And then, let's see, I already talked about the public health coordinator grant getting that $5,000 back. And then I talked about the co-ed clerical position with the $33,000. That would be the end of that fund. And then employee position number 12, the environmental specialist, that's the one that we did not fill that vacancy last year. We are doing okay with that. I would not, it's only been a year. And it's pushing the limits of what I feel comfortable with as a department head, and I feel like it should probably be pushing the limits of what the county should be comfortable with. She's basically taking on 2 full-time roles with that. There is some help and some division inside of the office when it comes to paperwork, but the amount of physical inspections is, I mean, she's getting pulled all over the county for everything, and we have a great tourism draw in this county, and a lot of it has to do with the historic parts, and a lot of it has to do with, we have some really good restaurants and really good food that people come into town just for that. They don't necessarily come into town for, on a regular basis all the time just for the historic, but also for the food. And she's doing a great job maintaining. We have the part-time food specialist, which has really helped pull some of that weight. But I feel like putting all of our knowledge into one person when it comes to septic, food safety, all of the laws. I mean, if you guys want to come and sit down with me, I'm more than happy to share what all of those are and the ins and outs and the nuances, but it just takes a really long time for someone to get very well acclimated with those processes. And we're getting ready to have some new codes come down, so she's gonna have to learn, they're both gonna have to learn some of those things. And between both roles, I just don't feel like it's been a very fair employment process here with putting both of those roles on her. So with that being said, I just feel like that's something that you guys should know. And then the last one we did hit on was the behavioral health navigator. That was a 3-year grant from Bethany Legacy that pays for both the salary and the benefits of this person. So we started it mid 2025, so it should go through mid 2028.
I'm sorry to interrupt you. Who's doing
which employee's doing the two jobs? Oh, I'm not
Okay.
with
11.
names.
11,
11 is doing 11 and 12, right?
yes.
Okay, I got you.
And while he's there, I thought the environmental specialist was supposed to be a required position in
It
every
is.
county.
It
So it's
is.
just a split, I mean,
So,
responsibility.
most counties have, they have smaller counties have one, so we're not out of the range of that, except for the fact that we have a lot more food establishments than a lot of our like-sized.
I know they all have to
county.
do every food truck for every festival.
Yes,
And there's a lot of distance to cover doing the other job.
yes.
County is east and west and.
Yes, the
It's
septic,
long.
she's been out to Canton, today already and back and some other, like, she's doing a great job at it, but I just, it feels a
Her
little bit
mileage
much.
is probably,
What a part.
Her mileage is insane, her comp time is something that's becoming concerning.
Would a part-time person be able to do the?
We have a
Environmental?
part-time person who's doing some of the food. I mean, theoretically, a part-time person who could learn some of the, like, septic and other
Yes,
environmental
that's right.
aspects could be a potential.
Are we beyond in the comp time? What, I mean, we have a policy now. in
Yes,
place.
she's tiptoeing that line, so she keeps taking it to make sure that she doesn't get over it. So
then it's
we're,
probably a catch 22, because if she takes time off, then she
Still needs to be
has to
done.
catch up.
yeah,
Yeah,
so it's, I mean, we tiptoe, we tiptoe that line really closely. It's become, like I said, it is, the comp time thing is becoming a bit of a problem. I mean, it might be something where we end up having to put some additional funding to pay it out, because I don't know that it's possible.
Long term, that's just.
Yeah.
At the end of the year, what we've been doing, we go through and we pull the list from the timekeeping system, and if they are over that, we go to commissioners and we tell them we need to pay this out, and we basically find a way to pay it out, but obviously we need to try to not get to that limit would be ideal.
Agree. One, financially, but two, I just think
don't wanna overwork her either.
Don't.
that's what, I
The
don't burn
comp
her
time-
out.
The comp time would go a long way if she didn't have that to pay him for that part-time. That's something to think about.
But ideally, I think it's not a concern. The full-time food specialist, I mean.
So I left it,
Available for a part-time
yeah.
environmental specialist.
Yes, I left the title of food specialist on number 11, just because that's what the actual, the account line is called.
But
She
she's-
has fully transitioned and.
Gotcha.
Yes, the role is being filled properly,
it's being
according to like what the state requires.
And how much of the position 13, are we getting 20 hours? Oh.
So-
How many hours a week of work are we getting from that individual?
Part-time food. You know,
She typically works once a week. But it's like 7 or 8 hours.
so we're getting 7 to 8 hours out of that person a week, so.
Ideally, it would be to add back that full-time position.
I mean, what's
Right.
budgeted would get you
Yes.
9.6 hours a week is all. I mean, if on average 7 or 8 hours, really, there's not much more budgeted than that anyway.
Yeah. So for festivals and stuff like that, there's some plans to kind of help if necessary, and
Sorry, Heather, say that one more time.
Ideally, it would be best to add back that environmental position or a food specialist, you know, vice versa, full-time. Knowing that you have someone trained that on slow days, she could assist in either.
And additionally, like, that's something, a lot of counties that have more than one, they did not have it divided, like the environmental only versus food only aspect. They are dual purpose employees, so that's what happened moving forward. They would be cross-trained to do the whole thing.
So, I'm sorry, so you're almost suggesting if part-time, 7, 8, no more than 9.5 hours a week, what we have budgeted for food specialist was eliminated, if the full-time environmental specialist was reinstated, these individuals could be cross-trained, where the food and safety and environmentalists could certainly cover for each other, but we would have two full-time positions, potentially the $10,000, the part-time food specialist could be eliminated
I
then.
think previously the environmentalist was not trained for food, nor was there an interest for that.
Fair statement, okay?
Correct.
He was particular.
What, did the co-ed nurse change to behavioral health? What,
So the co-ag nurse, we just, that's the position that we had to eliminate.
okay,
So no, the full-time registered nurse that is also was known as the immunization nurse, because that's part of some of that grant that we had for a while, which they've done away with. No, the behavioral health navigator is brand new. It was kind of a community effort. There were several different agencies that wanted to see somebody who could direct people to the proper resources in our community. So we ended up with a grant as a pilot to see how it worked through back.
Originally kind of hopeful, primarily focusing on substance abuse, but ended up being even more so in mental health.
But we are working a lot with different substance abuse agencies. I think we've done some pretty decent stuff so far in the year.
We were talking with, Josh Webb, he said that the overdoses are trending down. So we want that to stay that way, knock on wood, but maybe that's reflective of some of the stuff you all's efforts.
I definitely think some of the people in programming that we've been able to bring into the community has been more effective. We've had a lot of programming at different places and hodgepodge, like piecemeal, siloed things. And I think now we've brought in agencies that are more equipped to deal with a whole, like a whole person, so everything that they deal with on a regular basis. And I think we've been able to help bridge the gap between, now that there's the JCAP program, and we've brought in this behavioral health navigator has brought in another agency to work with individuals after release. So we're just kind of, we're able to be with them for longer with different programming. And I think some of that stuff is, it's gonna start showing some better trending numbers. Do we have any more questions on this sheet, or do we want to talk about the other one?
Thank you for this. This was very helpful.
You're welcome.
Been doing this 12 years. I still don't know how you guys keep this straight.
We don't. We have to like close the door and do a deep dive. But I guess some of it we really do keep some of it straight, but some of it we have to let go and do it later.
Are immunizations still trending down, or are they moving back up?
As a whole, they are, I think, kind of leveling out a little bit. For us, they're doing better. We're gonna talk about why. I can go ahead into it, but right now with Madison Pediatrics just getting started, still kind of getting their footwork. They're doing a lot of their private vaccine referrals to us because, as you guys know, it takes money to purchase those private vaccines up front. So you have to put money into it so that you can get more out of it, which we are doing. So I can skip to that part where it says year to date, so far we have $68,500 in our, that's made it into 1159, so it's made it into the fund. We have an approximate $50,000 getting transferred this week into it as well. So our expenses, which we are gonna have to, you will be seeing an appropriation, an additional request coming soon, because last year we only put $70,000 into the public health line item with the intent that we would come back and ask for more once we made money, which we have. So we've made about over $30,000, so it's a return on investment of about 35% for what we spent so far. And that does include, it does include what's in the account right now that we have not transferred into the county's fund. But we are anticipating about $20,000 to $50,000 additional in the next couple months, just because of those referrals from Madison PF.
Currently, the county fund is sitting at 250,000, and that's with the $40,000 loan in it, which is significantly better than what we have, yeah.
Mhm.
We've been in the past, so it is definitely, it's working, it's trending up.
There has been some stuff that we have, currently, the expenses have been out of the Health First funding. We're watching those numbers, because some of that should be getting spent out of 1159, so the tax levy fund, we did have it. The money and the funds appropriated in 1159, just hasn't been spent out of there yet. Because we're watching, Heather and I've been watching the fund closely to make sure that we're balanced between the two, and both of them end up being at a sustainable level for next year. So there might have to be, towards the end of the year, some corrections made to balance those out. But right now, both of these funds are sitting at about the same dollar amount. You guys have those in front of you, so the top line,
They were so close.
isn't it? So they're very close.
That's why I said, I don't know if it's better to bring this one lower or bring this one lower. I think we should just wait.
So we're
Let's just see what happens.
Yeah.
It's a waiting game.
But you'll see under the second box where it says 1161, there's almost $68,000 that's been spent on Social Security, perf, and health insurance that should have been spent out of 1159. But until we know that we can pay back the loan and make sure that we're in good standing for next year, we just don't feel like it's a good opportunity, a good option to move it over yet, so. In the top box on 1159, you'll see some of the other year-to-date, so environmental revenues, we've brought in almost $55,000 between our food and environmental, lodging, tattoos, all those different things kind of factor into that same environmental revenue.
Bouncing to one question, I guess. We previously weren't paying any utilities for the health first fund, but this next year you have $25,000 budgeted.
We are paying them out of Health First.
We haven't budgeted in 1159. That's one of the corrections that we're referring to.
Because last year they were all getting.
Taking some of them from the other. Up to, yeah.
Seeing this stipend that was given for that was added to Health First for the fatality review coordinator, not questioning that, just made me think this morning when Josh was here, I did ask a question. I'm not the problem solver, I just try to be a middleman and connect the right people, because we toward the beginning of this term and just had some concerns that test certificates weren't being signed on a timely basis. We had found some old emails for positions that needed to be corrected and just the process and some complaints that sometimes came to your department when your hands were tied. And I kind of asked him if he felt like the process was better as far as communication with the health department and hospital. He had a lot of good information to share. So I think we got a clear answer on that one. He felt like things were better. I guess I wrote a note to myself. I wanted to ask you the same thing. Do you feel like on your end
Yes,
that?
I think things are going a lot smoother between, I think the physicians in general, I think the access to I know that they had changed some accesses and the way that certificates were signed.
Yeah,
So I think,
there's a new system he had. With this system was.
but there was it's, especially when the hospital has enough, transient doctors, it makes it difficult to make sure that they're able to log in and actually sign that certificate. So it does there were some issues before that. I feel like it's running a lot smoother now.
I think a lot of it was obviously the patient unfortunately expired in the emergency room.
With an emergency room doctor.
The emergency doctor doesn't want to sign it, their primary care doc, who may not have even seen them for, I just was on your end to make sure things were happening a little more timely and.
I think things are flowing much better now from all aspects. Yes.
And you referenced the health coag grant. This year is the final year?
I thought
Would that be
this-
a July 1 to June? I guess we'll go through that.
Last year, we had anticipated this being the last year of that grant, but that's when we still had the coag nurse getting paid out of this fund as well. And since we did away with that position, the school health liaison, it extended the life of that fund. So now we're anticipating 2027 being the last year of the funding for that.
And would that, I mean, again, I know since certain things and state funding current mid-year, so it would go through the end of 2027.
No, it would go through just however, it would go through probably about now of 2027. So it'd be about 33. So it can cover straight salary or salary and benefits. I mean, there's no reason for it to cover salary and benefits if we're gonna have to pay for it out of a different fund at that point anyway, which it would go into the health first fund. So it can pay $33,000 approximate. That's a projection. That's based off of. Right now, we're 8 months in. I just did the math to project it out. So I mean, I've given.
It has to be spent by the state or it has to be returned. Yeah.
No. Nope. It was completely deliverable based. So we already did what we needed to for that grant. They gave us the funding, and as long as we keep up with it and report on it, we're good.
I have a question on, going back to the, public health coordinator. Is that like inspector?
Public health coordinator. No, that's
What's some of the things that they're responsible?
okay. So that is actually our nursing department, like sort of director over the nursing area. I did not create this title, but it's a title I inherited for this individual. They do I think it's because they have that emergency preparedness grant. So they are required to meet with different, like they have monthly meetings, district meetings between other healthcare, like you have EMS, you have the other EMA departments, and they have to meet, they have to do training exercises, they have certain deliverables that are required. So every office has to do X number of activities that the state sends down to be able to get this grant funding. And that's what this person, about half of their job is based off of emergency preparedness. And the other half of their job is running the nursing department.
Okay, thank you.
You have anything else, Lindsay?
I have a couple things that don't really add up to much at the moment, but I just kind of wanted to make you guys aware that, our board has voted in the last meeting that they are going to do away with their stipends. So we're not gonna be paying board stipends, so we can take that off of our request, budget request for 2027. And then we've also started doing regular CPR and BLS classes at the health department. While I don't expect it to be incredibly lucrative at the intervals in which we're offering the classes, I do think that it will be a nice additional steady income. So we've hosted 2 classes so far. We've traveled to one business, just to see how that would work out. We are traveling to a school to do first aid, I think this week. And then, we have done some different stuff with some of the schools and teachers in the past before we kind of officially got something up and rolling.
I attended in Jennings County, I think it was last month. Adult Services Company. They contracted out to have someone come in and recertify everyone in CPR.
Nice.
So, yeah.
Yeah, there's a need for it. We definitely have our phone. You know, I won't say it's ringing off the hook, but I will say that, you know, people are calling and questioning and seeing if they can get into it.
How much are you charging for that?
It varies. I don't have that sheet in front of me, but I can.
Is it individual or just like a corporate, you really have to
So we
have?
have it a couple different, we have it set up a couple different ways. So when we host a class inside of the health department, we're charging them on an individual basis. They come in, they pay, they sit, they take the class. If they just want the CPR AED course, then they pay for that. And then when it's over, they can leave. If they want to add first aid to the end, there's an additional fee. So they can end up with one card that has CPR AED first aid, and they can stay until the end of the class. We have some really nice mannequins. We have like the Narcan and EpiPen testers, so people can kind of be familiar with what those feel like. I think we're gonna be working with the JCAP program to go over and teach at least the Narcan administration in that program. And potentially more, just depending on what, you know, what funding looks like. And BLS is a different course, so we do charge more for the BLS, which is basic life support. It's for providers, so we do have a class coming up at the end of this month where we have a couple nurses and some nursing assistants from some of our local retirement homes, nursing homes, both of those, and then we have a pharmacist, and I think we have some interest from a few of the dental offices to get restarted.
Can people purchase Narcan from the health department if they want to have something to help somebody?
So we actually have a grant that gives it out for free. So if somebody wants to come to the health department and watch like a 4-minute video, they can sign off on it and they can walk out with a couple doses. So so far, all of our classes have ended with, as long as they stay for the first aid, they walk away with 2 doses of Narcan after they.
That's very good.
On your IT contract, you have no control on that? The IT contract,
No, it's a set cost.
so it.
It's
nothing
through
goes-
Leap now, isn't it? Are you with us on Leap, or do you have your own?
I think, I don't know. I had my own. I have not been told if I'm having my own now, and it also covers like our security stuff.
Okay.
With being a standalone department.
Okay, so if you don't have anything go wrong, you still gotta pay that, right? The department's gonna pay it.
Yes. It's like our camera system and our badge access and stuff like that,
Okay.
I just didn't know if there's any way we could negotiate with them on that or not.
I don't think so. Now, that number might go down if we aren't paying for our own contract with Leap, but we can look at that. But there is a certain amount of that is set.
Going back to that, Narcan, how long does that grant last?
It's an annual grant,
That's an annual grant.
so we reapply every year. That's something that public health coordinator role, she maintains that grant. It doesn't cost us anything. It doesn't give us anything either. But
Yeah.
it provides us with the ability to request Narcan.
You have anybody on your staff that would be going out if somebody called to check for like mold or something in the,
No, we are not equipped for that. We do not have that kind of training or equipment to be able to detect or categorize different kinds of mold. I know that some of the larger health departments in the state, I think they actually do have those kinds of people and equipment, but that's not something that we are able to do. We can partner with the state, and we do if necessary, if we have like a child that tests high for a blood lead level. So if it's lead based, there, we do have some stuff like that we can go into a home and test for. We have to borrow equipment. The equipment's really expensive. We don't own it, but that's a nurse and environmental tag team.
Industrial hygienist.
What's that?
How industrial hygienist.
I do not believe we have any
We don't have
dentistry,
industrial hygienist.
industrial hygienist or anything like that in the county.
Like as a county employee, no, we do not. We
Contracted out.
Yeah, we have a dentist on our board, so, and we do pass out, we do have a grant that we get annually that we end up getting like toothbrushes and toothpaste that we give out to all second graders in our community. So we have that, but we don't have an actual like dental on our side.
And are you aware of any federal grants that are possibly on the horizon?
No, not at the moment. When Dr. Weaver came in, she did sound hopeful that maybe there's some potential to restore some of the Health First funding. So just for numbers sake, we have over this year and next year. So what we received in 2025 versus what we're receiving this year and next year is over, I think it was like $1.1 million difference than what we would have if we would have maintained the same level that we received in 2025. So that's what put us in this whole, we just kind of we're in the waiting game that we're in, where we're playing both of these funds to make sure that we're paying the appropriate thing out of the right funding, right? Because we want to make sure that both things are set up for future success. We don't really know 100% what that looks like at this moment, because $1.1 million over 2 years is kind of a big deal.
Yeah.
So.
Away, right when we got it.
Yeah. But she did feel hopeful that some of that might be reinstated, maybe not to a full value, but I've apparently talked sound positive. I don't know what that means. I mean, no one truly knows what that means until we see it, but they did ask for local health departments to reach out to partners, and I think we got some really great letters of support for maintaining or restoring some of the funding from different types of agencies. So all ranging from environmental to substance use to immunizations. So I think we're doing pretty good on that. And the immunization grant is gone. in 2027, it will not be. So we don't have an immunization grant anymore, just for those that remember how much we had in that one. For a couple years there, we had over $100,000 in an immunization grant that's also gone, so.
You guys have any more questions for Lindsay? Thank you, Lindsay.
If you guys end up doing an executive session that has to deal with like payroll or staff, that might be something that I would be interested in sitting in on.
So I can post for an executive session. And it would not be live streamed, and it would be a private meeting just to, when you discuss personnel, not necessarily their pay, but maybe their performance, it should be a private meeting.
I think that's probably,
Yeah, we'll
I'm going to happen.
I mean, I feel like you'll have that with other departments, so if that's the case, I'd just like to, I think there's a couple things.
It's almost certainly gonna happen.
Yeah. All right, any other questions?
Thank you.
Thank you.
Thank you.
Thank you.
I don't know how many of you have met Kaylin. She's been to a meeting before, but it's been a while, so this is Kaylin. So, she's the assistant administrator, which is why I was looking back at her when we were talking about some timekeeping questions, because she knows most of them. So, and with our accounts, so
Navigating the weeds of.
have a good day.
You as well.
Probably didn't need.
Results are, how the first submission.
No, no.
If
Oh, I-
if you meet certain parameters, that can become a health.
I'm not
Sure.
More sure about their, they discuss it about Courtney's some task. I mean,
So we are running about 15 minutes early. Are you guys ready to adjourn for lunch?
Yes.
Yeah.
Okay,